Hi, hello to all of you. It's all good. Hi, hi. Hello to all of you. So let us begin with the thorax now. A small topic, limited questions, easy to score, very important from practical point of view. Also, just one moment. I'll just take this up. One moment. Okay, fine. Chalo. So thorax में the first and the foremost very important topic, the intercostal space. Intercostal space. LQ आता है. अगर intercostal space LQ आया, very nice to write. It's a big question to write. Okay. Otherwise, some LQs like internal capsule, there's very less matter to write. तो अगर intercostal space वगैरह आता है तो जरूर उसे okay, you can always attempt that. Intercostal space. So let us understand the intercostal space. So muscles, vessels and nerves. Muscles, three muscles: external intercostal, internal intercostal, and the third muscle is the transverse thoracicus. External, internal and the transverse thoracicus. The transverse thoracicus itself is made up of three parts. Yes, can anyone answer this? The transverse thoracicus is made up of, so external intercostal, internal intercostal and the transverse thoracicus. I am writing in short. Transverse thoracicus is made up of three parts: sternocostalis, innermost intercostal and the subcostalis. Fine. Okay, fine. So external intercostal, internal intercostal and transverse thoracicus. Transverse thoracicus के तीन parts होते हैं: sternocostalis, innermost intercostal and subcostalis. But for all practical purposes, we take the three muscles as external, internal and innermost intercostal, right? External, internal and innermost intercostal. Hi, good evening to all of you. I'm starting now. Three muscles for all practical purposes: external, internal and innermost intercostal. How is the direction of fibers of external intercostal? Like putting the fingers in the pocket, downwards, forwards and medially. Iska downwards, backwards and laterally, internal intercostal. And transverse is the innermost intercostal is same as that of internal intercostal. Now tell me, which is the neurovascular plane of the thorax? The nerves and the vessels of the thorax lie between which two muscles? The nerves and the vessels of the thorax lies between the internal and the innermost intercostal, right? The nerves and the vessels of the thorax lies between the internal and the innermost intercostal. Where? In the costal groove. Costal groove होती है in the costal groove along the inferior border of the rib. And what is the sequence? Sequence क्या होता है? How is the sequence of structures? Yes, anyone? So the neurovascular plane of the thorax lies between the internal and the innermost intercostal in the costal groove along the inferior border of the rib, and sequence is, yes बच्चों बोलो, sequence कैसे होता है? Come on, I'm looking at the screen. हाँ, wait, स्वप्नमय, wait. Sequence कैसे होता है? Sequence is vein, artery, nerve. It's vein, artery, nerve from above downwards, from above downwards, and this sequence is reversed in first rib. First rib में ये ऐसे नहीं होता. First rib में it is nerve, artery, vein. Fine. So if I make three muscles here, look at this. अगर मैं ये तीन muscles लिखता हूँ, this is external intercostal, this is internal intercostal, and this is the innermost intercostal. Innermost intercostal. Fine. ये तीन muscles है thorax के. Nerves and vessels कहाँ पे होते हैं? Nerves and vessels are between the internal and the innermost intercostal. Fine. Now, if we compare this to the muscles of the neck, which is the neurovascular plane of the neck. Swapnamay, you were telling me this. Yes. Nerves and vessels in the neck are found between two muscles. Yes, very good to all of you, very good. Nerves and vessels of the neck. Matlab, which nerve and which vessel are we talking about? Anyone? Anyone? In the neck. कौन सी nerve and कौन सी vessel are we talking about? Swapnamay has just answered that. Between which two muscles answer kiya hai, but which nerve and what vessels are we talking in the neck? The neurovascular plane of the neck, जिसे हम बोलते हैं, that is the subclavian artery and the brachial plexus. Subclavian artery and brachial plexus याद है, in the neck lies between which two muscles? The scalenus anterior and the scalenus medius. Scalenus anterior and scalenus medius. So now, hi Veer. So just compare these three intercostal muscles with the three muscles of the neck. Just try to correlate this. Correlate this. So what will this correspond to? ये किसे correspond करेगा? This will correspond to the scalenus anterior. This would correspond to scalenus medius, and this would correspond to the scalenus posterior. अभी आप बोलोगे posterior सबसे अंदर है, external सबसे बाहर है, but that is embryology, that is developmental. Okay, so the innermost muscle of the thorax corresponds to which muscle of the neck? The scalenus anterior. Scalenus anterior. This corresponds to this. This corresponds to this. Now, in the abdomen, where do the nerves and the vessels lie? वैसे abdomen के भी तीन muscles हैं, external oblique, internal oblique, transverse abdominis. So, where do the nerves and the vessels lie? Yes, between in the muscles of the anterior abdominal wall, it lies between the internal oblique and the transverse abdominis. So, this muscle would correspond to the transverse abdominis. This would correspond to the internal oblique, and this corresponds to the external oblique. So, just क्या बोलूं इसको, correlation. Just a correlation between the muscles of the neck, muscles of the thorax, muscles of the abdomen. मतलब scalenus anterior muscle जो है neck का, it corresponds to which muscle of the thorax? Innermost intercostal. Hi. And it corresponds to which muscle? ये किसके साथ correspond करता है? Abdomen के transverse abdominis के साथ. ठीक है? Clear to all of you? So just remember this. ये एक additional point मैंने बोलना है आपको. I've just told you this additional point. Fine. So that's about the intercostal muscles. उसका origin insertion लिखना है. Origin and insertion of intercostal muscles आपको लिखना है. Okay. Now you tell me, intercostal space है. Intercostal space begins from behind, पीछे से शुरू होता है, and it comes in front, आगे आ जाता है. The spaces in front, ये जो spaces है आगे, this is what we call as anterior intercostal spaces. ये है anterior intercostal spaces. What are these spaces? एक मिनट. What are these spaces? These are the posterior intercostal spaces. So ये जो arteries है, arteries, इसका नाम क्या होगा? Posterior intercostal arteries. And ये जो arteries है, ये होंगे anterior intercostal arteries. Okay, I'm just telling you the vessels of the thorax, arteries and veins of the thorax. So we start with, चलो, if you can identify this artery, ये कौन है बच्चों? What is this artery? ये कहाँ से देख रहे हो? आपने thorax को निकाला, you open the anterior wall of thorax and you're looking from inside, अंदर से देख रहे हो, you're looking from inside, अंदर से देख रहे हो. What is this artery? Answer this. Anyone? What is this artery? Which is a branch of the first part of the subclavian artery. ये subclavian artery है, ये first part है, ये second part है, ये third part है. So this is a branch from the first part of the subclavian artery. नाम internal thoracic artery. Very good. So ये है internal thoracic artery. ये कैसे देख रहे हो? आपने anterior wall को निकाल दिया and you're looking from inside, अंदर से देख रहे हो. So this is the internal thoracic artery. At the sixth intercostal space, it divides into, what is this A and what is this B? ये A कौन है, B कौन है? हाँ. So this is the internal thoracic artery. It divides into a superior epigastric. ये है superior epigastric and ये है musculophrenic. Musculophrenic. Very good to all of you. So internal thoracic artery is a branch of the first part of subclavian artery. At the sixth intercostal space, it divides into a superior epigastric and musculophrenic. Superior epigastric and musculophrenic. ठीक है? अब ये कौन है? What are these arteries? These are the anterior intercostal arteries. Anterior intercostal arteries. So now you tell me, anterior intercostal arteries in the upper six spaces. In the upper six spaces are branches of internal thoracic artery. So anterior intercostal arteries in the upper 6 spaces are branches of internal thoracic artery. In the lower spaces ये किसके branches होते हैं? Musculophrenic artery. Hi Ansh. Sorry. So anterior intercostal arteries in the upper 6 spaces are branches of internal thoracic artery. In the lower spaces, these are branches of musculophrenic artery. Clear hai bachcho? Is this clear to all of you? How many anterior intercostal arteries are there? There are 2 anterior intercostal arteries in each space. There are 2 anterior intercostal arteries in each space. Am I clear to all of you? ये क्लियर है? एंटीरियर इंटरकॉस्टल आर्टरीज बच्चों ये बहुत इंपॉर्टेंट है, ऑलवेज आस्क्ड, एमसीक्यूज में आता है, वाइवास में पूछते हैं, थ्योरी में एलएक्यू आता है, इंटरकॉस्टल वेसल्स, राइट? क्लियर? Now coming to the posterior intercostal arteries. Now these are the posterior intercostal arteries. Posterior intercostal, hi Richard, hi, yes. So posterior intercostal arteries in the lower spaces are branches of what? Answer this. Posterior intercostal arteries in the lower spaces are branches of, what is this? Yes. Yes, Rabia, very good. Richa, Ansh, Swapnamay, Shushant, yes, very good, very good. बहुत अच्छा, neat cracker. Akshat, Shrikant, SS Dash. हाँ, yes. वो जो सुपीरियर एपिगैस्ट्रिक आर्टरी है ना, वो फोरामेन ऑफ मोगैग्नी से जाती है, एनास्टोमोसिस करती है इंफीरियर एपिगैस्ट्रिक आर्टरी के साथ इन द रेक्टस शीथ. दैट्स फाइन. सो द पोस्टीरियर इंटरकॉस्टल आर्टरीज इन द लोअर स्पेसेस आर ब्रांचेस ऑफ डिसेंडिंग thoracic aorta. ये देखिए, this posterior intercostal arteries in the lower spaces are branches of descending thoracic aorta. In the upper two spaces, these are branches of, yes, superior intercostal artery, which is a branch of costocervical trunk, which is a branch of second part of subclavian artery. मतलब second part of subclavian artery कहाँ होता है? Second part of subclavian artery is behind the scalenus anterior. ये देखिए बच्चों, ये अंदर से देख रहे हो, ये कौन है? ये subclavian artery है. What is this muscle? ये है scalenus anterior. So scalenus anterior divides the subclavian artery into 3 parts. First part, second part, third part. ठीक है? So scalenus anterior जो है, it divides the subclavian artery into 3 parts. अब from the second part of subclavian artery, एक branch होती है, that is costocervical trunk. Costocervical trunk का एक branch है superior intercostal artery, and superior intercostal artery gives posterior intercostal artery in the upper two spaces. Fine? ठीक है बच्चों? So एक बार वापस बोलता हूँ, understand this. Anterior intercostal arteries in the upper 6 spaces are branches of internal thoracic artery. In the lower spaces, these are branches of musculophrenic artery. The posterior intercostal arteries in the lower spaces are branches of descending thoracic aorta. In the upper 2 spaces, these are branches of the superior intercostal artery, which is a branch of costocervical trunk, a branch of second part of subclavian artery. Yes, Swapnamay. ठीक है? अब कितने posterior intercostal arteries होती है? There's only one posterior intercostal arteries. तो this posterior intercostal artery gives a branch. उसका नाम है collateral branch. अब ये 2 posterior intercostal arteries will anastomose with the 2 anterior intercostal arteries. हाँ बच्चों, इसमें बस ये फ्लो चार्ट से लिखना है आपको. So the 2 posterior intercostal arteries anastomose with the 2 anterior intercostal arteries. Fine? Yes. Okay. Now coming to the veins, just have a look at this. Coming to the anterior and posterior intercostal veins. So now you tell me, bacho. Yeah, coming to the anterior intercostal veins. Same hai. What is this internal thoracic vein? अगर ये इंटरनल थोरैसिक वेन है तो हु इज दिस? सुपीरियर एपिगैस्ट्रिक. ये कौन है? मस्कुलोफ्रेनिक. सो ये है इंटरनल थोरैसिक वेन, सुपीरियर एपिगैस्ट्रिक, मस्कुलोफ्रेनिक वेन. सो व्हाट आर दीज? एंटीरियर इंटरकॉस्टल वेन्स. सो एंटीरियर इंटरकॉस्टल वेन्स. हाँ, यस यस, आई एम फोकसिंग ऑन इंपॉर्टेंट टॉपिक्स. ये इंपॉर्टेंट है क्रिश, ये इंपॉर्टेंट है. आई एम फोकसिंग ऑन इंपॉर्टेंट टॉपिक्स ओनली. यस, ये बहुत इंपॉर्टेंट है, इसके लिए फोकस करो. ठीक है. सो fine. So anterior intercostal veins in the upper 6 spaces drains into what? Internal thoracic vein. In the lower spaces drains into musculophrenic vein. So मैं थोड़ा fast जा रहा हूँ, so everything gets covered. ठीक है Krish? Now coming to the posterior intercostal veins. Understand this. ये बहुत important है, इसका short note भी आता है. Okay, I'll start. Have a look at this. Answer. ये कौन है? What is this vein coming from the neck? ये कौन है? Who's this? Who's this? And who's this? ये कौन है? What's this? SVC. So ये कौन है? Internal jugular vein. Who's that? Subclavian vein. ये है brachiocephalic vein. ठीक है. So right internal jugular, right subclavian joins to form the right brachiocephalic. Left internal jugular, left subclavian. ये बन गया left brachiocephalic. Both the brachiocephalic joins to form the SVC. SVC. And what is this? What is this? A single unpaired. यह है azygous vein. Azygous vein. Fine. Okay, so this is azygous vein. Now I'm starting with the posterior intercostal veins. Posterior intercostal vein, ये बहुत important है. So I'll just finish this. Posterior intercostal veins, देख लो, ये azygous vein पे भी short note आता है. You have to draw this diagram. Fine. Now coming to the first right posterior intercostal vein. The first right posterior intercostal vein drains into the right brachiocephalic vein. The first left posterior intercostal vein drains into the left brachiocephalic vein. The second, third, and fourth joins to form, this will join to form the right superior intercostal vein. The second, third, and fourth joins to form the right superior intercostal vein. This drains into azygous vein on the right side. Second, third, and fourth on the left side joins to form ये होगा left superior intercostal vein. This drains into the left brachiocephalic vein. ये सब MCQs में आता है. This all comes in MCQs. So what is right superior intercostal vein? ये कैसे बनता है? Right second, third and fourth posterior intercostal vein से बनता है. The right superior intercostal vein कहाँ पे drain होता है? Azygous में. Left superior intercostal vein drains into left brachiocephalic. Fine. Now all the veins on the right side drains into what? Sorry, all the veins on the right side drains into azygous vein. All the veins on the right side drains into azygous. On the left side, 5, 6, 7, and 8. 5, 6, 7, 8 joins to form a vein. इसका नाम है accessory hemiazygous vein. Accessory hemiazygous. 9, 10, 11, 12 joins to form hemiazygous vein. Fine. बस ये याद रखना, azygous vein short note आता है, you have to write the same thing. Fine. Posterior intercostal veins आता है, you have to write the same thing. Okay, clear students? So just remember this, intercostal veins याद रखना. Fine. Now we come to the intercostal nerve. Now what is an intercostal nerve? बस एक short में बोलता हूँ. What is an intercostal nerve? It is the ventral ramus of a thoracic spinal nerve. Ventral ramus of a thoracic spinal nerve. Normally ventral ramus of a spinal nerve से क्या बनता है? Plexus. Ventral ramus of a spinal nerve forms a plexus. Normally thorax में there is no plexus. So what happens to the ventral ramus? ये ventral ramus, it runs in the intercostal space. उसी को हम बोलेंगे intercostal nerve. Fine. So what is an intercostal nerve? It is the ventral ramus of a thoracic spinal nerve. Ventral ramus of a thoracic spinal nerve. Branches. Number 1. What is this branch? Can anyone tell me? This is number 1. This is number 2. And then it gives branches here. These are muscular branches. So what is number 1 and what is number 2? So intercostal nerve is the ventral ramus of a thoracic spinal nerve. It runs in the intercostal space. इसके branches क्या होते हैं? Number 1 are the muscular branches. Number 2, what is this and what is this? This is known as the anterior cutaneous nerve. Anterior cutaneous nerve, and this is known as the lateral cutaneous nerve. Lateral cutaneous nerve. ठीक है? Branches to the pleura is fine. So, but main branches क्या है? These are anterior cutaneous nerves. These are lateral cutaneous branches. हाँ, lateral cutaneous branches. बस ये याद रखना. For typical and atypical intercostal nerves, याद रखना. This comes in MCQs. Fine. Yes, Muskan. Very good. Okay, so now chalo bolo now. What are the types of pleura? Yes, what are the types of pleura? Like understand this lung. Agar ye lung hai, so ye apex hai, ye base hai. What is this surface? Mediastinal surface. What is this surface? Costal surface. So what are the parts of the lung? Apex, base, mediastinal surface, costal surface. Now, pleura is of pleura is of two types. Ek pleura which encircles the lungs, enters the fissures of the lungs. What is that? Yes, fine. What is that? Ek pleura hota hai which covers the lungs, enters the fissures of the lung. This is the visceral pleura. The second pleura is reflected around the lung. That's the parietal pleura. Parietal pleura is of four types. Now, ये MCQs में आता है. So, parietal pleura is of four types. Yes, cervical, mediastinal, diaphragmatic, and costal. So what is this? Parietal pleura. Parietal pleura is of four types. Costal, cervical, mediastinal, diaphragmatic. इसका nerve supply बोलो. Nerve supply is very important. इसका nerve supply is asked in the MCQs. So, costal and cervical pleura is supplied by intercostal nerves, and this is supplied by phrenic nerve. Okay, so this is supplied by phrenic nerve. Clear? Fine. So, costal and cervical pleura is supplied by intercostal nerves. The mediastinal and diaphragmatic pleura is supplied by phrenic nerve. Fine. So just remember the types of the pleura, the parts of pleura. Now, the cervical pleura is further covered by what? The cervical pleura is further covered by, what is this known as? The cervical pleura is further covered by Simpson's fascia. इसका नाम है Simpson's fascia, or the suprapleural membrane, or the cervicothoracic diaphragm, or the scalenus minimus. ठीक है, ये चार नाम है. So the cervical pleura is further covered by Simpson's fascia, or it is known as the cervicothoracic diaphragm, or it is known as the scalenus minimus muscle. And what is the extent of this cervical pleura? इसपे clinical question आता है. Clinical question comes like this. A person is hit here by a bullet at the root of the neck. The person is hit at the root of the neck by a bullet. Bullet injury होता है. After recovery, the person finds a swelling at the root of the neck. So what is this? Yes, Snehal, we'll discuss बाद में. Snehal, I'll talk to you later. Just wait. What is this? He finds a ballooning of the lung here. So this is injury to the Simpson's fascia. So Simpson's fascia क्या करता है ना? It prevents the ballooning of the lung. You can't see the lungs जब expand होता है, we can't see it here. Why? Because इसको cervical pleura cover करता है. Fine. ये clinical question आता है. So just understand this. What is the extent of this Simpson's fascia? Simpson's fascia extends from the transverse process of C7 to the inner border of the first rib. Cervical pleura का extent क्या है? Transverse process of C7 to the inner border of the first rib. Function है, it prevents the ballooning of the lungs at the root of the neck. Fine है. बाकी fascias बोल सकते हैं. Which is the pelvic diaphragm. दूसरे diaphragm बोल सकते हो. Pelvic diaphragm is formed by what? यह है cervicothoracic diaphragm. Fine. Pelvic diaphragm is formed by what? Come on, students, can you answer this? pelvic diaphragm, ये just a correlation. तो सिप्सन्स फेशिया क्या होता है? सर्वाइको-थोरैसिक डायफ्राम है, वैसे पेल्विक डायफ्राम भी होता है. Which is a pelvic diaphragm? Any guesses? Pelvic diaphragm. Pyriformis नहीं है बच्चे, pyriformis नहीं है. Pyriformis is known as the key muscle of the gluteal region. Pelvic diaphragm is the levator ani. Oral diaphragm. Yes, very good. Oral diaphragm is formed by what? Oral diaphragm. Anyone? Oral diaphragm. MCQ आता है ये, oral diaphragm. Fine, Muskan, fine. Oral diaphragm is formed by yo floor of the mouth. ये कौन है? बोलो. Oral diaphragm is formed by. You can guess. Oral diaphragm is formed by mylohyoid. Very good. Oral diaphragm is formed by mylohyoid. Very good. Mylohyoid, soft palate नहीं. Mylohyoid is the oral diaphragm. यह है cervicothoracic diaphragm. यह है अपना thoraco-abdominal diaphragm, जिसे हम बोलते हैं the diaphragm. एक pelvic diaphragm होता है, which is levator ani. Fine. And coccygeus. Fine. Levator ani. Fine. Extent of lung आना चाहिए. Extent of pleura आना चाहिए. Can anyone tell me what is the extent of lung in the mid clavicular line, mid axillary line, and the mid scapular line? Anyone? What is the extent of lung and what is the extent of pleura? ये MCQs में पूछता है. So extent of lung in the mid clavicular line, mid axillary line, and mid scapular line. Okay, very good, Akshat. Urogenital diaphragm. Urogenital diaphragm is formed by two muscles. Anyone? अक्षत ने बोला है urogenital diaphragm. Very good. I forgot that. Urogenital diaphragm is formed by two muscles. Any guesses? एक मिनट. Just answer this. Urogenital diaphragm किससे बनता है? Can anyone answer this? Urogenital diaphragm is formed by two muscles. जब अपन urogenital diaphragm बोलते हैं ना, it is nothing but the superior layer of urogenital diaphragm. वो अपन abdomen में पढ़ेंगे. We'll see that in abdomen. The superior layer of urogenital diaphragm, which is known as the urogenital diaphragm, is formed by two muscles, the sphincter urethrae and the deep transverse perineum. Sphincter urethrae and the deep transverse perineum. इसे हम बोलते हैं urogenital diaphragm. Fine, याद रखना. हाँ, very good, मुस्कान. Sphincter urethrae, deep and superficial नहीं. Sphincter urethrae and the deep transverse perineum. Okay, cremaster नहीं है बच्चे. Cremaster is very superficial. Cremaster is in the inguinal canal. Dartos is a muscle of the scrotum. ठीक है ना? Urogenital diaphragm वो तीन fascias है ना urogenital diaphragm के. Perineal membrane नहीं है बच्चे. Perineal membrane is the inferior layer of urogenital diaphragm. जब अपन urogenital diaphragm बोलते हैं तो it is understood it is the superior layer of urogenital diaphragm and it is formed by two muscles, sphincter urethrae and the deep transverse perineum. Fine. Hi Shippy. Fine. Good. So what is the extent of lung? The extent of lung is the 6th rib, 8th rib and 10th rib. 6, 8, 10. And what is the extent of pleura? 8, 10 and 12 ribs. 8, 10 and 12 ribs. हाँ, ये याद रखना. 6, 8, 10, 8, 10, 12 ribs. तो वो costodiaphragmatic recess, costomediastinal recess याद रखिए. This is very important. So ये costodiaphragmatic recess, costomediastinal recess बनते हैं. Just remember that. ये अपन है ना, there's one lecture on practicals after FARRE series. एक practical series का lecture है, तो उसमें we'll see that. Fine. Okay. Now एक है ना, एक first rib आता है. This is very important. First rib. That's the head of the rib. That's the neck of the rib. ये है tubercle and that's the shaft of the rib. Shaft. Head, neck, tubercle and ये होगा shaft of the rib. What is this? ये क्या है? Can anyone tell me what is this? मुस्कान क्या हुआ? What is this tubercle? हाँ, what is this tubercle? First rib पे एक tubercle होता है, नाम बताओ. What is this tubercle? Attachments on the first rib you have to know. Attachments on the first rib. This you should know. So what is this tubercle? ये number 1 है muscle. Fine. There's a muscle here. Number 2. there's a muscle here. Number 3, there's something here. This is number 4, and चलो बोलो जल्दी. Answer this. So this is the scalene tubercle. हाँ, ये है scalene tubercle. ये muscle number 1 is the scalenus anterior. याद रखना बच्चों, this is very important. First rib is always asked. So first rib पे scalenus anterior होता है, scalene tubercle होता है, that's scalenus anterior. What is this? Number 2 is the scalenus medius. Scalenus medius. Number 3 कौन है? Who's number 3? हाँ, Krish, very good. This is Simpson's fascia. Number 4 is the Simpson's fascia. 3 कौन है? Number 3 कौन है? Who's number 3? Serratus anterior. Very good, Richa. Number 3 is serratus anterior. The first digitation of serratus anterior. ये है scalenus medius. ठीक है, ये है scalenus anterior. And this is Simpson's fascia. Simpson's fascia. Okay, relations of the neck of the first rib. This is extremely important. MCQs में भी आता है ये. Relations of the neck of the first rib. Anyone? This is SVAN. Medial to lateral. SVAN. हाँ. What is S? चलो बोलो जल्दी जल्दी. S is the sympathetic chain. Sympathetic chain. V is the first posterior intercostal vein. A is the superior intercostal artery, and N is the first thoracic nerve. First thoracic nerve. Fine. So just remember this SVAN. SVAN sequence have medial to lateral. ये हमने देखा था when we discussed the relations of the alveolosacrum. SLIO. Relations of the alveolosacrum याद है? SLIO. SLIO. So this is SVAN, sympathetic chain, the first posterior intercostal vein, the superior intercostal artery, and the first thoracic nerve. Fine. So this becomes the relations of the neck of the first rib. So this is about the first rib. Yaad rakhiye, this is very important. Fine. Okay. Now coming to this bronchopulmonary segments. Very important topic. Bronchopulmonary segments. Short note bhi aata hai. You get diagrams of bronchopulmonary segments. ये देख लेते हैं. We'll just see this bronchopulmonary segments. Have a look at this. So this is the right lung. This is the anterior border of the right lung. ये है left lung. This is the cardiac notch. ये होगा lingula of the left lung. Okay. Now this is the oblique fissure. This is the oblique fissure. ये है horizontal fissure. Upper lobe, middle lobe, lower lobe, upper lobe, lower lobe, upper lobe and lower lobe. Okay, now you tell me, trachea divides into two primary bronchi. Two primary bronchi for two lungs. The primary bronchus divides into secondary bronchi depending on the number of lobes. जितने lobes है उतने secondary bronchus होंगे. So ये है right primary bronchus divides into how many secondary bronchus? 3. ये 3 secondary bronchus देगा. This is the secondary bronchus for upper lobe, secondary bronchus for middle lobe, secondary bronchus for lower lobe. The left primary bronchus gives 2 secondary bronchus for the upper lobe and lower lobe. ठीक है ना? Fine. So trachea divides into 2 bronchus, 2 primary bronchus, 2 lungs के लिए 2 primary bronchus. Each primary bronchus divides into secondary bronchi depending on the number of lobes. So right gives 3 secondary bronchi, left gives 2 secondary bronchus. Now each secondary bronchus divides into tertiary bronchus. First year का batch will start from अभी क्या चल रहा है? August, September, end of September. हाँ. Hi Siraj. So the part of the lung which is supplied by one tertiary bronchus, उसे हम बोलते हैं bronchopulmonary segment. So what is a bronchopulmonary segment? ये bronchopulmonary segment क्या होता है? It's the part of the lung which is supplied by one tertiary bronchus. ठीक है? So now understand bronchopulmonary segments. So part of the lung supplied by one tertiary bronchus. Just have a look at this. So we'll start with the bronchopulmonary segments of the right lung. Right lung, अपर लोब, चलो आंसर करिए। राइट लंग अपर लोब के 3 ब्रोंकोपल्मोनरी सेगमेंट्स, दिस इज अपाइकल, दिस इज एंटीरियर एंड दिस इज पोस्टीरियर। फाइन। मिडिल लोब के 2 ब्रोंकोपल्मोनरी सेगमेंट्स होते हैं, दिस इज मीडियल एंड दिस इज लैटरल। लोअर लोब has got 5 bronchopulmonary segments, 5, this is apical, इसका दूसरा नाम है superior segment, superior segment और apical, ये है anterior, ये है lateral and ये है posterior, basal, basal, ये सब basal segments है। so anterior basal, lateral basal and posterior basal, बस ऐसे याद रखना, बहुत इंपॉर्टेंट है। So bronchopulmonary segments of the upper lobe of the right lung, apical, anterior, posterior, ये MCQs में भी आता है। Middle lobe, medial and lateral. Lower lobe, apical, also known as superior, anterior basal, lateral basal, posterior basal, and एक अंदर होता है, that is medial basal, अंदर की तरफ, that's medial basal. Fine. Now coming to the left lung के bronchopulmonary segments देखिए, सेम है, दिस इज अपाइकल, दिस इज एंटीरियर, दिस इज पोस्टीरियर, अपाइकल, एंटीरियर, पोस्टीरियर, दिस इज सुपीरियर लिंगुलर एंड दिस इज इंफीरियर लिंगुलर, सुपीरियर एंड इंफीरियर लिंगुलर। अगर एमसीक्यू आता है ब्रोंकोपल्मोनरी सेगमेंट्स ऑफ द लिंगुलर लोब आर, योर आंसर, ब्रोंकोपल्मोनरी सेगमेंट्स ऑफ द लिंगुलर लोब आर, क्या बोलोगे? Bronchopulmonary segments of the lingular lobe are superior and inferior lingular. अगर MCQ आता है, हाँ, अगर MCQ आता है bronchopulmonary segment of the upper lobe of the left lung, तो कितने होंगे? 5, 5, 3 and 2, 5. Fine. So bronchopulmonary segment of the left lung, upper lobe 5. But अगर MCQ आता है bronchopulmonary segments of the lingular lobe 2, superior, inferior, lingular. Fine. क्लियर है? हाँ। Now coming to the lower lobe same bronchopulmonary segments, this is apical, anterior basal, lateral basal, posterior basal and one is medial basal, medial basal. Normally जब पीजी के बच्चों को सिखाते हैं ना नीट पीजी में, so we say medial basal segment is absent in the left lung, ठीक है? medial basal segment is absent in the left lung. So left lung में actually 9 होते हैं, right lung में 10 bronchopulmonary segments होते हैं, but for you you take it as 10 and 10. हाँ, फर्स्ट ईयर के बुक्स में मेंशन नहीं किया है वैसे। फाइन। सो नाउ व्हाई दिस ब्रोंकोपल्मोनरी सेगमेंट्स इंपॉर्टेंट? अगर कोई डिसीज होता है, इफ दिस डिसीज, द डिसीज विल रिमेन कन्फाइंड टू दैट सेगमेंट। अगर निमोनिया होता है, सो इट विल रिमेन कन्फाइंड टू दैट ब्रोंकोपल्मोनरी सेगमेंट। अगर डिसीज एक्सटेंसिव है, लाइक कैंसर और ट्यूबरक्लोसिस, देन इट स्प्रेड्स थ्रू आउट द सेगमेंट्स। Otherwise, it remains confined to segments. So you can remove that segment. ये easy है, इसका निमोनिक मत याद रखो। निमोनिक ओनली डिफिकल्ट टॉपिक्स का याद रखना बच्चों, नहीं तो you'll get confused in the mnemonics. ये easy है। So now when we are removing a segment, आप एक segment निकाल रहे हो। So I mean, there's something which runs between the segments. You tell me, what is this structure which runs between the segments? हाँ, ये कौन है? ये कौन है? Who's this structure? अगर आप ये स्ट्रक्चर को ट्रेस करते हो, सो यू आर एबल टू डिफाइन वन सेगमेंट, सेकंड सेगमेंट, थर्ड सेगमेंट, फोर्थ सेगमेंट। सो व्हाट इज दैट स्ट्रक्चर which lies within the bronchopulmonary segments, or what is the structure which divides the bronchopulmonary segments? Anyone? Pulmonary veins. Very good. Pulmonary veins. So pulmonary veins are intersegmental. ये एमसीक्यू आता है। Pulmonary veins are intersegmental. हर एक सेगमेंट का अपना पल्मोनरी आर्टरी होता है। जस्ट सी, हर एक सेगमेंट का अपना पल्मोनरी आर्टरी होता है, टर्शियरी ब्रोंकस होता है। ओके, सो ईच सेगमेंट हैज अ सेपरेट पल्मोनरी आर्टरी, अ सेपरेट टर्शियरी ब्रोंकस, बट हर एक सेगमेंट का पल्मोनरी वेन सेपरेट नहीं होता। अंडरस्टैंडिंग? द वेन्स रन्स बिटवीन द सेगमेंट, मतलब पल्मोनरी वेन्स कैन ड्रेन मोर देन वन सेगमेंट। ये एक से ज्यादा सेगमेंट को ड्रेन कर सकते हैं। द पल्मोनरी वेन्स आर intersegmental. Yes, that is why bronchopulmonary segment is not a bronchovascular segment. Very good. Shipra, very good. It's not a bronchovascular segment because particular vein एक segment के लिए नहीं है. You understood now, all of you? समझ में आया ये? हाँ, हर एक सेगमेंट का अपना पल्मोनरी आर्टरी है, अपना टर्शियरी ब्रोंकस है, बट अपना पल्मोनरी वेन नहीं है. द वेन रन्स बिटवीन द सेगमेंट. द वेन कैन ड्रेन मोर देन वन सेगमेंट्स. द वेन इज सेड टू बी इंटरसेगमेंटल. हाँ, okay, fine. So that's about the lungs. Fine. Okay, clear to all of you? So just tell me one thing. ये जो pericardium है, the covering of the heart is a pericardium. Pericardium is made up of two parts, two layers. Two layers. Can anyone tell me this? Pericardium is made up of two layers. Huh? Anyone? नौ बजे रवि. 9 o'clock. 9 o'clock. So एक है serous pericardium, serous, and एक है fibrous pericardium, fibrous. Okay. So pericardium is of two types. दो types का होता है ये pericardium. एक है serous pericardium, एक है fibrous pericardium. Fine. Just one moment. Serous and fibrous pericardium. Now, what is fibrous pericardium? Fibrous pericardium just covers, मतलब heart को पहले serous pericardium cover करता है and put the heart in the fibrous pericardium. Fine. अब serous pericardium के दो layers है, visceral layer and parietal layer. Parietal layer, ठीक है? So heart is first lined by, अगर ये heart है, अगर मैंने ऐसे हार्ट ड्रॉ किया, सो व्हाट इज दिस पेरिकार्डियम व्हिच इज मेड अप ऑफ टू लेयर्स. ये है विसरल लेयर एंड ये है पैराइटल लेयर. ये है सीरस पेरिकार्डियम. हाँ, ये है सीरस पेरिकार्डियम. एंड द एंटायर हार्ट इज पुट इन अनदर पेरिकार्डियम. व्हाट इज दिस पेरिकार्डियम? ये है फाइब्रस पेरिकार्डियम. ये है फाइब्रस पेरिकार्डियम. ओके, फाइन. सो पैराइटल लेयर ऑफ सीरस पेरिकार्डियम and fibrous pericardium is supplied by what? ये दोनों फ्यूज हो जाते हैं. ये fibrous pericardium and the parietal layer of serous pericardium ये फ्यूज हो जाते हैं. They are supplied by what? Anyone? Anyone? So this is fibrous pericardium. ये समझ में आया ना बच्चों? This is fibrous and this is serous. This is serous. Serous के दो layers, parietal and visceral. So parietal layer of serous pericardium and fibrous pericardium is supplied by phrenic nerve and visceral is supplied by autonomic. Autonomic मतलब sympathetic and parasympathetic. हाँ, the nerve supply of the heart है वही nerve supply of visceral pericardium होगा. And the parietal pericardium and the fibrous pericardium is supplied by phrenic nerve. This comes in MCQs. बच्चों ये MCQs में आता है. हाँ, so just remember this. Yes, fine. Okay, चलो. Now we'll start with the blood supply of the heart. हाँ, we'll start with the blood supply. बच्चों मैं directly explain कर रहा हूँ ये. हाँ, just try to understand this. I'll start with the surfaces and then the blood supply of the heart. Quickly you answer this. Now, what is this surface of the heart? ये क्या surface है heart का? ये सब वाइवास MCQs में पूछता है. What is this surface? यहाँ पे क्या होता है? Manubrium sternum है, यहाँ पे body of the sternum है, यहाँ पे costal cartilages है. So, what is this surface of the heart known as? Yes, Akshat, very good. Yes, anyone? यहाँ पे आएगा manubrium sternum है. ये straight आ गया body of the sternum. दोनों sides पे costal cartilage. So this surface is known as the sternocostal surface. Sternocostal surface. Quickly, I'm telling you the blood supply of the heart. Blood supply of the heart बोल रहा हूँ. So now you tell me what is this chamber? ये कौन सा chamber है? Right atrium. This is the right ventricle. That's the left ventricle. Fine. What is this groove? ये groove का नाम क्या है? 1. And what is this groove? Number 2. Chalo, answer this. So sternocostal surface of the heart is made up of right atrium, right ventricle, left ventricle. Fine. What is this groove number 1 and what is this groove number 2? तो ये होगा sternocostal surface of the heart. Anyone? This is the anterior atrioventricular groove and this is the anterior interventricular groove. ठीक है, anterior atrioventricular groove, anterior interventricular groove. हाँ, एक शॉर्ट में I'll explain you the coronary circulation which is very important for you. हाँ, coronary circulation पे LA क्यों आता है? Describe the coronary circulation of the heart. So पहले you have to write about the grooves and then you write about the coronaries. बाकी clinical बहुत है उसमें, angina pectoris, myocardial infarction बहुत है लिखने को. Fine. Coronary sulcus. हमीद ये ना जितने भी ग्रूव्स है ना सबको कोरोनरी सल्कस बोलते हैं, जितने भी ग्रूव्स हैं सबको कोरोनरी सल्कस बोलते हैं. बट कोरोनरी सल्कस अगर पीजी नीट का सवाल है, हाँ, इफ इट्स अ पीजी नीट क्वेश्चन, तो कोरोनरी सल्कस इज द ग्रूव इन व्हिच द कोरोनरी साइनस लाइज. कोरोनरी साइनस लाइज. आप फर्स्ट ईयर की बुक्स देखोगे तो सारे सल्कस को कोरोनरी सल्कस बोला है. बट अगर ये पीजी नीट का सवाल है, इफ यू आर अटेम्प्टिंग अ क्वेश्चन ऑफ पीजी नीट, कोरोनरी सल्कस इज, देन आई विल टेल यू कोरोनरी सल्कस वो ग्रूव है जिसमें कोरोनरी साइनस होता है. व्हाट इज दैट ग्रूव? एनीवन? एनीवन? यस अक्षर, इट्स अ पोस्टीरियर एट्रोवेंट्रिकुलर ग्रूव. It's a posterior atrioventricular groove. We'll see this. See, this is how the level of MCQ changes. First year and NEET PG. Understand? Posterior atrioventricular. Yes, very good. Richa, ठीक है. Fine. ये क्या surface है? Sternocostal surface of the heart. ठीक. अब same surface, same slide, I'm drawing in a different view. देखिए, same slide, I'm drawing in a different view. फटाफट ये खत्म कर लेते हैं, क्रिश. ठीक है. ये pulmonary arteries, ये arch of aorta. Fine. Now have a look. I'll draw one slide here for you. ऐसे स्लाइड्स ड्रॉ करना आपको एग्जाम्स में. फाइन. ओके, हैव अ लुक. ये क्या सरफेस है? स्टर्नोकॉस्टल सरफेस. ये स्टर्नोकॉस्टल सरफेस है. व्हाट इज दिस फॉर द हार्ट? दिस इज द बेस ऑफ द हार्ट, बेस. एंड ये क्या सरफेस है? डायफ्रैग्मेटिक सरफेस. तो हार्ट के 3 सरफेसेस है. हार्ट इज समथिंग लाइक दिस. ये है स्टर्नोकॉस्टल सरफेस, ये है एपेक्स ऑफ द हार्ट, ये होगा बेस ऑफ द हार्ट एंड दिस इज द डायफ्रैग्मेटिक सरफेस ऑफ द हार्ट. नीट यूजी के लिए नहीं है बच्चों ये. नो पीयूष. ठीक है, तो दिस इज द स्टर्नोकॉस्टल सरफेस, दिस इज द एपेक्स. एग्जैक्टली पीछे जाओगे आप, पीछे पीछे पीछे. दैट इज दिस, दैट्स द बेस ऑफ द हार्ट. एंड ये जो सरफेस है, दैट्स द डायफ्रैग्मेटिक सरफेस ऑफ द हार्ट. दैट्स अ डायफ्रैग्मेटिक सरफेस. ठीक है पीयूष, ये नीट यूजी के लिए नहीं है. दिस इज फॉर द एमबीबीएस एंड द. फाइन. ओके, नाउ हैव अ लुक एट दिस. लुक एट दिस. This is the anterior atrioventricular groove. अब मैं पीछे जा रहा हूं. I'm going back. What is this groove? What is this groove? This is the posterior atrioventricular groove. Same here. This is the posterior atrioventricular groove. मैंने हार्ट को टर्न किया. This is the anterior atrioventricular groove. अपन पीछे जा रहे हैं. We are going back side. That's a posterior atrioventricular groove. I turn the heart and that's a posterior atrioventricular groove. Fine. What is this groove? This is the anterior interventricular groove. अब मैं नीचे जा रहा हूं, नीचे. What is this groove? This is the posterior interventricular groove. ये होगा posterior interventricular groove. Posterior interventricular groove. समझ में आ रहा है? Are you able to follow this? So this is the anterior atrioventricular, that's a posterior atrioventricular, that's an anterior interventricular, posterior interventricular groove. This is the sternocostal surface. Heart को turn किया. That's a base. That's a diaphragmatic surface. Okay, just try to understand this. ऐसे समझ लो इसको. Okay, look at this slide. This is a beautiful slide. ये देख लो. चलो बच्चों start. I just put numbers. आप answer करिए. ये क्या surface है? What is this surface? Sternocostal surface. ये क्या chamber है? What is this chamber? That's a right atrium, right ventricle, left ventricle. Fine. What is this groove? ये क्या groove है? This is the anterior atrioventricular groove. What is this groove? This is the anterior interventricular groove. Fine है? Now, अब अपन पीछे जाते हैं. We are going backside. What is this groove? ये क्या groove है? This is the posterior atrioventricular. And what is this? Posterior interventricular groove. Fine. Okay, now just understand the surfaces. ये क्या surface है? Sternocostal surface made up of right atrium, right ventricle, left ventricle. Fine. A part of right atrium is here. A part of right atrium is here. The rest of the right atrium कहाँ गया? पीछे पीछे पीछे. And what is this chamber? जो एकदम पीछे है. What is this chamber? That's the left atrium. ये right atrium है. A part of right atrium पीछे की तरफ गया. And this complete chamber is the left atrium. Now we turn the heart. Heart को turn करते हैं. What is this chamber? ये है right atrium and that's the left atrium. मतलब the base of the heart is formed by what? The base of the heart is formed by both the atria. Fine बच्चों? ये देखो ना, इसको turn किया तो ये आ गया. This is the right atrium. This is the right atrium. And ये left atrium है, ये left atrium है. मतलब the base of the heart is formed by what? Both the atria. Am I clear? Base of the heart is formed by both the atria. Now you tell me, what is this chamber? Left ventricle. A small part of left ventricle is here. A major part of left ventricle goes down, down. That's this, left ventricle. This is the right ventricle. A part of right ventricle goes down. That's the right ventricle. मतलब ये क्या surface है? Diaphragmatic surface. Diaphragmatic surface is formed by both the ventricles. ये MCQs में आता है. Fine. ये clear है? Surfaces, grooves clear है? So coronaries are very easy. Fine बच्चों. Okay. Okay, I'm starting now. I'm starting with the coronary arteries. I'll just see if I've got a slide there. Okay, look at this. I'll start here. This is the sternocostal surface. That's a right atrium. That's a right ventricle, left ventricle. This is the posterior atrioventricular groove. This is the posterior interventricular groove. Okay, I'll start. Now tell me, ये coronary arteries कहाँ से शुरू होता है? Coronary arteries begins from the coronary sinus present in the ascending aorta. Ascending aorta में दो dilatations होते हैं. That is the coronary sinus. So coronary arteries begins from the coronary sinus. Okay, I'll start. The right coronary artery first runs in the anterior atrioventricular groove. This is the right coronary artery. First runs in the anterior atrioventricular groove. Now goes in the posterior atrioventricular groove. ठीक है, 2 minutes. I'll just finish this. Runs in the posterior atrioventricular groove. It gives a branch here. It gives a branch here. It gives a branch here. What is this branch? नाम बोलो इसका. So the right coronary artery first runs in the anterior atrioventricular groove. Now goes in the posterior atrioventricular groove. It gives a branch here. इसका नाम बताओ. What is this branch? Yes, come on, students, come on. What is this branch? This is the posterior interventricular artery. That's a posterior interventricular branch of right coronary artery. This is the right coronary artery. So the right coronary artery first runs in the anterior atrioventricular groove, now goes in the posterior atrioventricular groove. It gives a branch here. This is the posterior interventricular artery. Fine. Coming to the left coronary. The left coronary comes from behind the pulmonary trunk. ये pulmonary trunk के पीछे से आती है. Now divides into two branches. Answer this. ये कौन है? What's this? Number 1. What's that? Just wait, Shipra. What is this? This is known as the LAD, left anterior descending. Or this is the anterior interventricular branch of left coronary artery. Anterior interventricular branch of left coronary artery. Just wait, let me finish this. It is not complex, bacho. It is easy. So this is the anterior interventricular branch of left coronary artery. First runs in the anterior interventricular groove, अब ये पीछे जाती है in the posterior interventricular groove. It anastomosis with the posterior interventricular branch of right coronary artery. हाँ, okay. What is this branch? एक दो मिनट, I'll finish this. What is this artery? This is the circumflex branch. Circumflex branch runs in the posterior atrioventricular groove, anastomosis with right coronary artery. Fine बच्चों, ये याद रखना. Now tell me, what is this branch? What is this artery which runs along the margins here? What is this artery which runs along the margins? ये है marginal artery. Marginal artery. That's fine. ये ना revision lectures है ना बच्चों, so I'm just quickly going through it, हाँ? Quick go through है ये lectures. These are revision lectures. Fine बच्चों, come on. Now you tell me, what is this? ये कौन है? What is this artery? This is the posterior interventricular artery. This posterior interventricular artery is a branch of right coronary artery in 85% of the cases. अगर ये branch right coronary का है, we call this as the right coronary dominance. So who decides the cardiac dominance? The posterior interventricular artery. If this is a branch of right coronary, तो वो right coronary dominance होगा. अगर ये circumflex आ गई, circumflex comes here and circumflex gives this branch, so it is the left cardiac dominance. ठीक है? So cardiac, अगर posterior interventricular artery is a branch of circumflex, it is the left coronary dominance. ठीक है? And अगर दोनों भी branches देते हैं, it is codominance. Codominance. बस ये याद रखना. The cardiac dominance is determined by what? The posterior interventricular artery. Posterior interventricular artery. Fine, बच्चों. A quick go through it. A quick go through. Okay. Okay. Understand the veins draining the heart. Veins draining the heart. या ना MCQ में आता है. MCQ आता है. एक बेटा, एक क्वेश्चन ऐसे आता है. हाँ, annulus of vesicalis is formed by the conus artery. हाँ, दोनों के ब्रांचेस आते हैं. conus वो नेकलेस बनता है. एक बेटा, क्लिनिकल सवाल ऐसे आता है. A person comes to the OPD, complaints of chest pain on exertion. Chest pain on exertion. मतलब when he's running or when he's climbing stairs, वो chest pain होता है. The person rests, थोड़ा देर रुकता है. हाँ, the person waits for some time. The chest pain is settled. Now the person starts to walk. Again, if the person runs, again he gets a chest pain. What is this clinical condition? Answer this. What is that clinical condition? Chest pain on exertion. क्या बोलते हैं ये clinical condition को? Yes. Hamid, wait. Angina pectoris. इसका ये है angina pectoris. Don't write it as myocardial infarction. हाँ, clinical सवाल में आता है. What is your diagnosis? Don't write it as a myocardial infarction. It is not myocardial infarction. It is angina pectoris. Atherosclerosis biochemistry में है. Atherosclerosis biochemistry में है. Anatomy में angina pectoris. Fine. That's fine. That's fine. So chest pain अगर वो क्योर नहीं किया, then it results in myocardial infarction. ठीक है? Then it results in myocardial infarction. ठीक है? याद रखना. नहीं तो बच्चे क्या लिखते हैं ना, बच्चे immediately लिखते हैं myocardial infarction. Atherosclerosis भी लिखते हैं, but that is biochemistry. That's fine. I hope you've got this. Yes. Now you tell me, MCQ आता है. हाँ. The vein which the surgeon encounters in the anterior interventricular sulcus of the heart. Answer this vein. The vein which the surgeon encounters in the anterior interventricular sulcus. Any guesses? Vein का नाम. This is the great cardiac vein. Great cardiac vein. So the vein which the surgeon encounters in the anterior interventricular sulcus is the great cardiac vein. ये यहां से आ गई marginal vein. That's a marginal vein. So the great cardiac and the marginal vein अब join होते हैं to form the largest vein of the heart, the biggest vein, the largest vein of the heart. What is this vein? This is the coronary sinus. That's the coronary sinus. So how's the coronary sinus formed? It is formed by the great cardiac vein and the marginal vein. The great cardiac vein joins with the marginal vein. Ab banega coronary sinus, and this coronary sinus lies where? In which groove does it lie? That's a posterior atrioventricular groove. Posterior atrioventricular groove, and this groove is known as coronary sulcus. अगर पीजी नीट में ये सवाल आता है, coronary sulcus is, your answer is the posterior atrioventricular groove. Fine. I hope this is clear. Posterior atrioventricular groove. That's the coronary sulcus. Okay. Now, what is this vein here? यहाँ पे एक vein होती है. Oh, what is this vein? This is the middle cardiac vein. And that's a small cardiac vein. बस इतने veins याद रखना. Main चीजें I'm telling you, the main things I'm telling you. Oh yes, all 5 years portion for NEET. Sub 19 subjects, all 19 subjects for NEET PG. Fine बच्चों, so that's about the veins draining the heart. ये याद रखना, arteries and veins याद रखना. Hi Ayush. Okay, now you tell me, which is the complete chamber which lies behind? The complete chamber which lies behind. ये हमने heart को lift किया. हमने heart को lift किया. ये है coronary sinus. This is the posterior atrioventricular groove. मतलब this is the diaphragmatic surface. This is the base of the heart. Base of the heart पे where coronary sinus is formed by great cardiac vein and marginal vein. एक मिनट, I'll just show him. देखो ये great cardiac vein है, ये marginal vein है. So great cardiac and marginal vein ये बना coronary sinus. ये है coronary sinus, and coronary sinus opens into right atrium. Coronary sinus opens into the right atrium. याद रखना. Okay, so which is the complete chamber which lies behind the left atrium? And left atrium में क्या खुलता है? Pulmonary veins खुलता है ना, pulmonary veins. And sometimes the pulmonary veins bring more blood, ज़्यादा blood लेके आते हैं. So the left atrium has to distend. There's a space here. There's a space behind the left atrium. नाम बोलो. Thank you. There's a space behind the left atrium. What is the name for this? हाँ बच्चे आसाम में हो गए. Oblique sinus. So this is the oblique sinus. ये याद रखना, oblique sinus एक space होता है behind the left atrium for distension of the left atrium. जैसे stomach के पीछे एक space होता है. Yes, Akshat, you know what questions I'll ask. Yes, if I come as a practical examiner for you, you know all my questions now. Yes, which is a space behind the stomach. Stomach के पीछे भी एक space होता है which helps in distension of the stomach after having food. What is that space known as? Yes, anyone? What is that space behind the stomach which helps for the stomach to distend? Stomach के पीछे. Bolo, I'm looking at the screen. Bolo, lesser sac. Yes, lesser sac. Akshat had answered that. Yes. Lesser stomach bed nahi bache. Stomach bed nahi. Stomach bed is the one on which the stomach is lying. Stomach and stomach bed के बीच में जो space होता है, that's the lesser sac which helps in distension of the stomach. Fine. Okay, so that's the oblique sinus. MCQ आता है, oblique sinus lies behind. Your answer, left atrium. Fine. And look at this. What is this? What is this sinus? मतलब ये कौन है? SVC है ना? ये SVC है. This is the ascending aorta and that's a pulmonary trunk. मतलब ascending aorta and the pulmonary trunk together they form one unit. ascending aorta and pulmonary trunk एक यूनिट होता है because they develop from same chamber, same embryological chamber से बनते हैं ये दोनों. And SVC, इनके बीच में एक स्पेस होता है. That's a transverse sinus. ये है transverse sinus. So transverse sinus is present between the ascending aorta and the pulmonary trunk, anterior and to the left, and SVC posterior and to the right. So this is the transverse pericardial sinus. Very good. ये याद रखना. Transverse sinus का what is the importance? जब cardiac surgeries होती है, so you can put a ligature from here, ऐसे thread डाल सकते हो, and you can tie the ascending aorta. Ascending aorta को tie कर सकते हैं to control the blood flow during cardiac surgeries. Excellent. Very good. Excellent. Good, good, good. All of you have done. All of you have studied very well. चलो एक ये देख लेते हैं. We'll see this. What have we done? We have opened the right atrium. Right atrium को खोल दिया. What is this? अगर इसको बंद कर देते, you close this. What is this line which joins the SVC to IVC? ये line का नाम बोलो. This line which joins the SVC to IVC from outside is known as the sulcus terminalis. ये line बाहर से, it is known as the sulcus terminalis. Yes, Swapna. The same line from inside, what is this known as? Crista. इसका नाम है crista terminalis. मतलब बाहर से sulcus terminalis, the same line from inside is known as crista terminalis. Now this crista terminalis divides the right atrium into two parts. This is the rough part and this is the smooth part. ये सब पूछते हैं. Right atrium comes as a short note. Interiors of right atrium comes as a short note. Bacho, you have to know this. So line joining the SVC to IVC, बाहर से sulcus terminalis, अंदर से same line को बोलते हैं crista terminalis, divides the right atrium into a rough part and a smooth part. The rough part, what is this known as? इसको क्या बोलते हैं? Musculi pectinati. Muscular pectinati. So this looks like the teeth of a comb. This looks like the teeth of a comb. This is known as musculae pectinati. Musculae pectinati. Fine. The smooth part shows three openings. The smooth part shows three openings. Number one is the opening of SVC. Number two is the opening of IVC. Number three, ये कौन है? Who's number three? Number one is the opening of SVC. Number two is the opening of IVC. And who's number three? That's the opening of. That's a coronary sinus. Coronary sinus. ठीक है बच्चों? So this is the interior of right atrium. Now this opening of IVC, यहाँ पे एक valve होता है. What is this valve known as? This is the Eustachian valve. Eustachian valve. And the opening of coronary sinus, what is this? Thebetian valve. Okay, this is very important. ये याद रखना. Thebetian valve. So opening of IVC is guarded by a valve जिसका नाम है Eustachian valve. Opening of coronary sinus, वहाँ पे एक valve होता है, that is known as the Thebetian valve. ठीक है? Clear? Fine to all of you? Okay. Now tell me, this is the right atrium. Who's on that side? That side, left atrium. That side is the left atrium. What is this? ये कौन है? ये. This is the interatrial septum. Interatrial septum. Yes. What is this depression known as? This depression is known as what? And ये जो elevation है, this is known as what? Interatrial septum. नहीं, ventricle पे नहीं आता बच्चे. शरण पाटिल नहीं आता. Yes. Number one is the fossa ovalis. So one, this is the interatrial septum. Interatrial septum पे जो depression है, that is known as fossa ovalis. जो elevation है, that is known as the limbus fossa ovalis, limbus fossa ovalis. ठीक है, सो इतना आपको लिखना है. अगर यहाँ से नीचे जाते हो तो दैट्स अ राइट वेंट्रिकल. यू कैन सी दिस वाल्व, इसका नाम है ट्राइकस्पिड वाल्व, दैट इज नोन एज ट्राइकस्पिड वाल्व. यस, fossa ovalis is septum primum, limbus fossa ovalis is septum secundum. Fossa ovalis is septum primum, limbus fossa ovalis is septum secundum. Fine. Okay, great. Fine. चलो, अच्छा, वो ट्राइंगल ऑफ कॉच, हाँ ये रह गया क्या? ओके, व्हाट इज दिस ट्राइंगुलर एरिया? हाँ, थैंक यू. ओके, व्हाट इज दिस ट्राइंगुलर एरिया नोन एज? एक मिनट, ये दिस ट्राइंगुलर एरिया इज नोन एज द ट्राइंगल ऑफ कॉच. ट्राइंगल ऑफ कॉच, गुड. दैट्स अ ट्राइंगल ऑफ कॉच. उसके बाउंड्रीज, नंबर 1, tricuspid valve का leaflet, one leaflet of tricuspid valve. Second, the opening of coronary sinus. And third, ये जो elevation देख रहे हो, इसका नाम है tendon of Todaro. Tendon of Todaro. So one leaflet, एक cusp, tricuspid valve का एक cusp. Second, opening of coronary sinus. And third, ये जो elevation देख रहे हो, this is known as the tendon of Todaro. Who lies here? Who lies in this triangle of Koch? What lies here is the AV node. The AV node lies here. The AV node lies here. Fine. And where does the SA node lie? The SA node lies at the junction of SVC with the right atrium. SA node कहाँ पे होता है? SA node होता है at the junction of SVC with the right atrium. That's the location of SA node. ये सब MCQs में आता है बच्चे. All this comes in the MCQs. Just remember this. Fine. Now, I'll just tell you embryology in short. जो important embryology है वो मैं बोल रहा हूँ. Fine. So when the heart develops, there are 4 chambers. 4 chambers होता है. 4 primitive heart के chambers देखिए. The primitive heart has got 4 chambers. This is the bulbous cordis. This is the ventricle. That's the atria. And what is this? Sinus venosus. Sinus venosus. So जब heart बनता है, when the heart is formed on the ventral aspect of the embryo. That area को हम बोलते हैं cardiogenic area. उसको हम बोलते हैं cardiogenic area. It is made up of 4 chambers: the bulbous cordis, the ventricles, the atria, and the sinus venosus. Sinus venosus, fine. 3 veins होते हैं which opens in the sinus venosus. Can anyone tell me this? 3 veins open in the sinus venosus. Anyone? There are 3 veins which opens in the sinus venosus. ये देखिए. What is this? Sinus venosus. 3 veins. One comes from the placenta. एक placenta से आता है. एक yolk sac से आता है. And the third comes from the body wall. Answer this. So this is the sinus venosus. There are 3 veins which drains into the sinus venosus. One is the umbilical vein. Umbilical vein कहाँ से आता है? Placenta से. Where is the umbilical vein? That's the umbilical vein. ये है umbilical vein. ये याद रखना बच्चों. This comes in MCQs. So veins draining in the sinus venosus. Number 1 is the umbilical vein. ये कहाँ से आता है? Placenta से आता है. Number 2 is the vitelline vein. Vitelline. This one is vitelline vein. Where it comes from? Yolk sac. It comes from the yolk sac. And number 3 is this. ये है common cardinal vein. Common cardinal vein ये कहाँ से आता है? Body wall से आता है. Body wall. ये याद रखना. ये हमेशा पूछता है. Veins draining in the sinus venosus. One is umbilical, one is vitelline, and the third one is common cardinal vein. common cardinal vein is formed by the joining of anterior cardinal vein and posterior cardinal vein. ये anterior cardinal, ये posterior cardinal join होता है to form the common cardinal vein. The common cardinal vein drains into sinus venosus. Fine, clear है ये? हाँ, याद रखना, this is very important. एक चीज बोल सकते हो, ये विटलाइन वेन से क्या बनता है? What are the derivatives of vitline vein? चलो बोलो, चलो I'll just ask you this. Vitline vein के derivatives बोलो. Vitline vein कहाँ से आती है? Yolk sac से आती है. It is going towards the sinus venosus. This vitelline vein forms what? हाँ, umbilical vein is fine. You just tell me vitelline vein forms what? Left umbilical vein forms the ligamentum teres. Right umbilical vein disappears. Very good. Vitline vein का बोलो. Vitline vein forms three things. Anyone? Vitline vein forms three things. एक तो वो hepatic sinusoids बनाता है. या ना, vitline vein is going towards the heart है ना बच्चे. Vitline vein is going towards the heart. बीच में लीवर आ जाता है. The liver comes in between. The vitline vein enters the liver. It gets broken down into the liver and it is going to form the hepatic sinusoids. ठीक है? Before the hepatic sinusoids, ये क्या बनाता है? Portal vein. हाँ. And ductus venosus. ये hepatic sinusoids में ही ductus venosus बनता है. And it forms the terminal part of IVC. उसको बोलते हैं hepatocardiac channel. Yes, very good. Hepatocardiac channel. So three things it forms. बस ये याद रखना. इतना याद रखोगे तो details then you can go into. The vitline vein forms, number one is the portal vein. Number two, it gets broken down into the liver to form the hepatic sinusoids, जिससे वो ductus venosus भी बनता है. And number three, it forms the terminal part of IVC. उसका नाम है hepatocardiac channel. Fine. Okay, what happens to the umbilical vein? Umbilical vein दो है, right, left. Right disappears. The left umbilical vein forms ligamentum teres. Fine. Ligamentum teres is the obliterated left umbilical vein. Fine है ना बच्चों, ये सब याद रखना. This is very important. And now comes the common cardinal vein. Common cardinal vein कैसे बनता है? Common cardinal vein, I'll just tell you this. यहीं पे खत्म करता हूँ. I'll finish this. This is the anterior cardinal vein. ये है posterior cardinal vein. अब ये बन गई अपनी common cardinal vein. मतलब anterior cardinal vein will bring the blood from above the heart. The posterior cardinal vein जो है, it will bring the blood from below the heart. They will join to form the common cardinal vein. And ये जो common cardinal vein है, this drains into sinus venosus. ये कहाँ पे drain करेगा? Sinus venosus में. Fine. So this is our anterior cardinal. This is our posterior cardinal. And that's our common cardinal vein. ठीक है? Fine. Okay. I'll just finish this. ये खत्म करता हूँ. Now, the two anterior cardinal veins are joined by an anastomosis. यहाँ पे एक anastomosis बनता है. So these are the anterior cardinal vein. The two anterior cardinal veins are joined by an anastomosis. Fine. Now, दो veins होते हैं which comes and joins this anterior cardinal vein. There are two veins which comes and joins this anterior cardinal veins. ये कौन है? This is the subclavian vein. ये रेडीमेड है. That's a subclavian vein. ठीक है. So ये तो anterior cardinal veins है दोनों sides के. The two anterior cardinal veins are joined by an anastomosis. The two subclavian vein comes and joins with the anterior cardinal vein. Fine है बच्चों, इतना clear है. Now, just tell me now, what is this going to form? The part of the anterior cardinal vein above the subclavian vein. ये क्या बनेगा? इंटरनल जुगुलर वेन. हाँ, ये सब पूछता है एम्ब्रियो में, सब पूछता है. हाउ इज द इंटरनल जुगुलर वेन फॉर्म? इट इज फॉर्म बाय द एंटीरियर कार्डिनल वेन अबाउट द अटैचमेंट ऑफ सबक्लेवियन वेन. सबक्लेवियन वेन तो रेडीमेड है. व्हाट इज दिस गोइंग टू फॉर्म? दिस इज गोइंग टू फॉर्म आवर, this is the right brachiocephalic vein. So right brachiocephalic vein is derived from the right anterior cardinal vein below the subclavian vein. Below the subclavian vein. अब ये पूरा क्या बनाएगा? This entire thing is going to form the left brachiocephalic vein. This is going to form the left brachiocephalic vein. So the left brachiocephalic vein is derived from the left anterior cardinal vein below the subclavian vein and the anastomosis. है ना, ये थर्ड लेक्चर है बच्चे. दिस इज द थर्ड लेक्चर. जस्ट टेल मी which brachiocephalic vein is longer? The left. The left brachiocephalic vein is longer. अब समझ में आया why the left brachiocephalic vein is longer? Because the left brachiocephalic vein is formed by the anastomosis also. ये anastomosis भी left brachiocephalic vein बनाता है. Fine. अब बोलो बच्चों, what is this going to form? ये क्या बनेगा? This and this. What is this going to form? This is going to form the SVC. SVC is derived from the right anterior cardinal vein and the right common cardinal vein. So SVC is derived from the right anterior cardinal vein below the anastomosis and the right common cardinal vein. Fine. बस ये याद रखना. This is very important. This is very easy. ये बहुत easy है. Clear? Fine. Now just tell me one thing. What does this form? This left common cardinal vein क्या बनाता है? This left common cardinal vein, what does it form? Anyone? The left common cardinal vein forms what? This forms the coronary sinus. This forms the coronary sinus, and this part, the left anterior cardinal vein, and the proximal part of left posterior cardinal vein. So this is the right anterior, sorry, this is the left anterior cardinal vein. बच्चों समझ में आ रहा है कि नहीं? ये बचा हुआ क्या है? Left anterior cardinal vein and the left posterior cardinal vein. हाँ, what is this going to form? Proximal part of the left posterior cardinal vein forms what? Anyone? ये जो बचा हुआ है ना, ये जो बचा हुआ है ना, left anterior cardinal vein and the proximal part of the left posterior cardinal vein joins to form what? This is a vein which drains into the left brachiocephalic vein. This is the vein which drains into the left brachiocephalic vein, and यहाँ पे तीन veins आके join होते हैं इसको. Second, third, and the fourth posterior intercostal vein. This is the left superior intercostal vein. ये बन अपना left superior intercostal vein. That's a left superior intercostal vein. बच्चे, you know this, no? Azygous नहीं बच्चे. Azygous is on the right side, बच्चा. Azygous is on the right side. Azygous नहीं बनाता है. ये बनाता है left superior intercostal vein. ठीक है? Fine. I was reading what you have written. ठीक है, fine. Clear है बच्चों? याद है ना, लेफ्ट सुपीरियर इंटरकॉस्टल वेन हमने ड्रॉ किया था. द लेफ्ट सुपीरियर इंटरकॉस्टल वेन ड्रेन्स इनटू द लेफ्ट ब्रेकियोसेफेलिक वेन. द लेफ्ट सुपीरियर इंटरकॉस्टल वेन इज फॉर्म्ड बाय द सेकंड, थर्ड एंड फोर्थ लेफ्ट पोस्टीरियर इंटरकॉस्टल वेन. वेरी गुड. तो ये हो गया वेन्स ऑफ अपर लिम्ब एंड थोरैक्स, वेन्स ऑफ थोरैक्स मेनली. ओके, फाइन. कमिंग बैक टू दिस. ओके, कमिंग बैक टू दिस. Now this bulbous cord is 4 chambers है of the heart. 4 chambers है heart के. So bulbous cord is divides into 2 parts. हाँ, bulbous cord के 2 parts बनते हैं. You can answer this. Bulbous cord के 2 parts बनते हैं. This is known as the conus and ये है truncus arteriosus. ट्रंकस आर्टीरियोसिस. सो बल्बस कॉर्डस के दो पार्ट्स बनते हैं, एक है ट्रंकस आर्टीरियोसिस, एक है कोनस. फाइन. एलाइड स्टूडेंट्स को ये नहीं है. एलाइड स्टूडेंट्स को एम्ब्रियो इज नॉट देयर फॉर द एलाइड स्टूडेंट्स. ठीक है, ये एमबीबीएस स्टूडेंट्स के लिए है. हाँ आयशा, फाइन. बट यू विल अंडरस्टैंड ग्रॉस बेटर इफ यू अंडरस्टैंड द एम्ब्रियोलॉजी. एम्ब्रियो अगर समझ में आता है तो ग्रॉस बहुत अच्छे से समझ में आता है. राइट. ओके बच्चों, नाउ यू टेल मी द बल्बस कॉर्डस डिवाइड्स इनटू अ ट्रंकस आर्टीरियोसिस एंड अ कोनस. अब जो कोनस है इट इज एब्सॉर्ब्ड इनटू द वेंट्रिकल्स. ये जो कोनस है ना, कोनस दैट गोज इनटू द वेंट्रिकल्स. कोनस आ गया वेंट्रिकल्स के अंदर. सो वेंट्रिकल्स का अपर पार्ट इज नोन एज कोनस. अब जो फर्स्ट चेंबर है, द फर्स्ट चेंबर इज नाउ द ट्रंकस आर्टीरियोसिस. द फर्स्ट चेंबर इज नाउ गोइंग टू बी द ट्रंकस आर्टीरियोसिस. allied is physiotherapy, nursing, the rest of them. Okay, fine बच्चों. So the bulbous cordis divides into a truncus arteriosus and conus. जो conus है that is absorbed into the ventricles. अब conus is a part of ventricles. The first chamber is truncus arteriosus. The next is the ventricles. Ventricles का upper part is the conus. The next chamber is the atria. The next chamber is the atria, and the ones which do not fuse, that's a sinus venosus. Sinus venosus. Fine. अब एक चीज बोलना, what happens to the truncus arteriosus? Can anyone tell me? In this truncus arteriosus एक septum बनता है. septum. इसका नाम है aortico. मैं डायरेक्टली बोल रहा हूं pulmonary septum. aortico pulmonary septum. I'm directly telling you. देखो बच्चों, देखो, इन दिस ट्रंकस आर्टेरियोसिस एक सेप्टम बनता है, नाम है एओर्टिको पल्मोनरी सेप्टम. एंड दिस सेप्टम इज गोइंग टू स्पाइरल स्पाइरल स्पाइरल. इसका दूसरा नाम है स्पाइरल सेप्टम. दिस सेप्टम डिवाइड्स द ट्रंकस आर्टेरियोसिस इनटू टू बिग वेसल्स. एनीवन? हाँ, इट डिवाइड्स इट इनटू ascending aorta and pulmonary trunk. Pulmonary trunk. Okay, so the spiral septum or the aorticopulmonary septum divides the truncus arteriosus into two big vessels. एक है ascending aorta, एक है pulmonary trunk. ठीक है. अब ये जो septum है ना, this septum, ये जो septum है aorticopulmonary septum, ये midline में form होगा. This is formed in the midline. So ascending aorta, pulmonary trunk, दोनों same size के होते हैं. Both are of the same size. Suppose if this aorticopulmonary septum shifts to the right side, अगर ये aorticopulmonary septum right side पे shift हुआ, so this results in what? If this aorticopulmonary septum shifts to the right side, it results in pulmonary stenosis. Pulmonary stenosis हो गया तो right ventricular hypertrophy होता है. Right ventricular hypertrophy हुआ तो there's an interventricular septal defect. And अगर interventricular septal defect हुआ तो over riding of aorta होता है. What is this known as? हाँ बच्चे, क्या डाउट है बोलो. हाँ, क्या डाउट है बोलो बच्चों. ठीक है, दैट इज टेट्रोलॉजी ऑफ फॉलेट. मतलब जस्ट अंडरस्टैंड दिस. द फर्स्ट चेंबर, चंपू क्या डाउट है बोलो. द फर्स्ट चेंबर इज ट्रंकस आर्टीरियोसिस. ठीक है, ये ट्रंकस आर्टीरियोसिस में एक सेप्टम बनता है, नाम है एओर्टिकोपल्मोनरी सेप्टम. ठीक है, इन दिस एओर्टिकोपल्मोनरी सेप्टम देयर इज द न्यूरल क्रेस्ट सेल्स व्हिच माइग्रेट. न्यूरल क्रेस्ट सेल्स इसमें जाते हैं. अगर न्यूरल क्रेस्ट सेल्स नहीं गए, the septum shifts to the right side. The septum shifts to the right side. This results in pulmonary stenosis. जब pulmonary stenosis होता है तो then because of that right ventricular hypertrophy होता है. Then what happens is the right ventricular hypertrophy होता है. Because of right ventricular hypertrophy, what happens is there is an interventricular septal defect. Interventricular septal defect. And because of interventricular septal defect, what happens is there is overriding of aorta. Who's this foolish person who's come? I don't know. Okay, chalo, let us continue. What happens is overriding of aorta. Okay, just that's fine. Okay, so that results in overriding of aorta. Fine. So this is known as the tetralogy of Fallot. Tetralogy of Fallot. ये याद रखना बच्चों. Clear to all of you? So what is the main cause of TOF? Main cause of TOF क्या है? Yes. What is the main cause of TOF? Pulmonary stenosis. Pulmonary stenosis. अब ये जो septum है ना, this septum spirals. This septum spirals. Okay. This septum spirals. It is also known as a spiral septum. It is also known as a spiral septum, and it spirals in such a way, ये ऐसे spiral होता है that aorta opens into left ventricle, pulmonary trunk opens into right ventricle. अगर ये spiraling ठीक से नहीं हुआ, the aorta opens opposite होता है. Normally aorta किस में खुलता है? Aorta opens into left ventricle, pulmonary trunk opens into right ventricle. ठीक है, this is normal. अगर ये spiraling ठीक से नहीं हुआ, exactly opposite occurs. And what is this known as? What is this known as? Yes, what is this known as? Okay, just concentrate on the lecture. Just forget those foolish people. Just concentrate on the lecture. ठीक है, that's okay. Yes, बोलो. What happens? अगर aorta right ventricle में खुलता है, pulmonary trunk left ventricle में खुलेगा. So what happens? What is this known as? This is known as transposition of great vessels. Transposition of great vessels. ठीक है? ठीक है ना? Normally ये septum क्या होता है? Squatting है अक्षर. SQUATTING. Squatting is like Indian toilets. Indian toilets में बैठता है ना, that is squatting position. हाँ, transposition of great vessels. Fine है, ये बच्चों clear है? So that is the first chamber. What is that chamber? That is truncus arteriosus. Truncus arteriosus में क्या होता है? Aorticopulmonary septum. I'll just remove this person out. Just 2 minutes. Sir, give me 2 minutes. I'll just remove this person. जैसे ना ऐसे लोग आ जाते हैं. Disturbing others. Their intent is to disturb others. Okay. I'm blocking him. Just wait 2 minutes. Okay, fine to all of you. Now we come to the next chamber. That is the ventricle. Ventricle. हाँ, जो इसको ब्लॉक कर दो. ये बोल दो टीम को ब्लॉक करने को इसको. Okay, now understand this. Coming to the next chamber, that's a ventricle. चलो. What is औकात का meaning पता है क्या? चंपू. Nonsense. Okay, coming to the next chamber. Now next chamber is the ventricle. The main intention is to disturb the lecture. ऐसे foolish people are always there. Just concentrate on the lecture. Now coming to the ventricles. Ventricles में एक septum बनता है. What is the septum? What is the septum? That is known as the interventricular septum. Interventricular septum. Okay, this interventricular septum is made up of 2 parts. Bolo, bachcho, come on. The interventricular septum is made up of 2 parts. One is known as the muscular part, and the other one is known as the membranous part. Membranous. Okay, so muscular part and membranous part. Fine. So एक septum बनता है ventricles के अंदर जिसका नाम है interventricular septum. Okay, look at this. So interventricular septum is made up of 2 parts. One is the muscular part, one is the membranous part. Now, can anyone tell me, this is the muscular part, this muscular part, and ये क्या? This is the muscular part, and ये क्या होगा? Membranous part. The muscular part grows in the floor of the ventricular cavity. जो muscular part है, it grows in the floor of the ventricular cavity. The membranous part is formed by mediastinum ना, mediastinum बोलता हूँ. The membranous part is derived from 2 sources. बोल सकते हो? The membranous part, interventricular septum, is made up of 2 parts, muscular part and membranous part. The membranous part is derived from bulbar septum and AV cushion. बस ये याद रखना. हाँ, नीट क्रैकर, गुड गुड. सो इंटरवेंट्रिकुलर सेप्टम के दो पार्ट्स होते हैं. एक मस्कुलर पार्ट होता है. मस्कुलर पार्ट grows in the floor of ventricular cavity. So interventricular septum के दो पार्ट्स होते हैं. One part grows in the floor of the ventricular cavity, उसे बोलते हैं muscular part. The membranous part is derived from two sources. Number one is the bulbar septum, which is formed in the conus, and number two is the proliferation of AV cushion. Proliferation of AV cushion. एम्ब्रियो इजी है बच्चे, एम्ब्रियो इजी है ना. सी अभी मैं पूरा एक्सप्लेन तो नहीं कर सकता. आई कैंट एक्सप्लेन एवरीथिंग इन दिस शॉर्ट सेशन, ठीक है ना. दिस इज जस्ट अ रिवीजन सेशन. अगर कुछ नहीं समझ में आया तो जस्ट अटेंड द अदर लेक्चर्स देयर ऑन यूट्यूब. आप देख सकते हो वो, यू कैन सी दोज लेक्चर्स. हाँ, देन यूल अंडरस्टैंड इट बेटर. ये रिवीजन लेक्चर है. हाँ, सो जस्ट द मेन पॉइंट आई एम फोकसिंग अपॉन. ठीक है, दिस इज फाइन. सो दैट्स अबाउट द इंटरवेंट्रिकुलर सेप्टम. Okay, now coming to the interatrial septum. Interatrial septum. Okay, answer this. Interatrial septum. चलो बोलो बच्चों, ये खत्म कर देते हैं. Interatrial septum. What is this? This is known as the AV cushion. AV cushion. Okay, I'll start. Now, एक septum चालू होता है. What is this septum known as? This is known as the septum primum. Septum primum. So a septum starts to grow from the floor, from the atrium. इसका नाम है septum primum. The septum primum is coming towards the AV cushion. वो AV cushion की तरफ grow हो रहा है. What is this opening known as? ये opening का नाम क्या होगा? This opening is known as the foramen primum. ठीक है, तो septum primum पहले start हुआ. Septum primum and AV cushion के बीच में जो gap है, what is this gap known as? Foramen primum. Fine. Now, this septum primum comes and fuses with the AV cushion. AV cushion के साथ fuse हो जाता है and then it breaks off. ये बीच में break हो जाता है. It breaks off in between. अब what is this known as? This is what we call as the foramen secundum. This is what we call as foramen secundum. Fine. Now, another septum starts to grow here. दूसरा septum grow होता है यहाँ पे. What is this septum known as? This is what we call as the septum secundum. Septum secundum. Fine. And now this opening is what is known as the foramen ovale. इसे बोलते हैं foramen ovale. एकदम सिंपल है. इंटरएट्रियल सेप्टम शॉर्ट नोट आता है. इंटरएट्रियल सेप्टम कम्स एज अ शॉर्ट नोट. तो पहले कैसे लिखोगे? अ सेप्टम स्टार्ट्स टू ग्रो फ्रॉम द एट्रियम. इसका नाम है सेप्टम प्राइमम. अब सेप्टम प्राइमम एंड एवी कुशन के बीच में जो गैप होता है, दैट इज नोन एज फोरामेन प्राइमम. द सेप्टम प्राइमम कम्स एंड फ्यूजेस विद द एवी कुशन एंड देन ब्रेक्स ऑफ. अब ये जो गैप है, दिस इज नोन एज फोरामेन सेकेंडम. Now, another septum starts to grow here. What is this septum known as? Septum secundum. And now, the septum secundum and septum primum के बीच में जो gap है, this is now what is known as the foramen ovale. Foramen ovale. So, final closure of foramen ovale occurs due to fusion of. ये MCQ आता है. Final closure of foramen ovale occurs due to fusion of septum primum and septum secundum. Septum primum and septum secundum. ठीक है ना. तो अपन राइट एट्रियम से देखते हैं ना. व्हेन यू सी फ्रॉम द राइट एट्रियम, ये डिप्रेशन दिखता है. ये डिप्रेशन दिखता है जिसे हम बोलते हैं फोसा ओवालिस. इसे हम बोलते हैं फोसा ओवालिस. एंड ये जो एलिवेशन दिखता है ना, दिस इज व्हाट वी कॉल एज द लिम्बस फोसा ओवालिस. हाँ, फोरामेन प्राइमम ऑस्टियम प्राइमम सेम है. सेम है नीट क्रैकर, सेम है. Okay, fine. Clear to all of you? बस ये याद रखना. Now, coming to this, just try to understand this. बस एक है ना, एक Okay. बोलता हूँ साइनोएट्रियल ऑरिफाइस वो इतना इंपॉर्टेंट नहीं है. साइनोएट्रियल ऑरिफाइस इज जस्ट फॉर योर अंडरस्टैंडिंग. वो उस पर नहीं आता है सवाल. दैट इज जस्ट फॉर योर अंडरस्टैंडिंग. ओके, नाउ आई विल स्टार्ट. लुक, टू बिगिन विद, हाउ मेनी pharyngeal arches are there? To begin with, कितने pharyngeal arches होते हैं? 6 pharyngeal arches, out of which one disappears off. एक disappear होता है. So there are 5 pharyngeal arches. 5 pharyngeal arches. To begin with, how many pharyngeal arches are there? 6. 6. Now, there are 2 heart tubes. जब heart tubes बनते हैं, there are 2 heart tubes. From these 2 heart tubes, what begins is the ventral aorta. Embryo ऐसे folded है. So 2 heart tubes नीचे की तरफ होते हैं. The 2 ventral aorta here, they join, they form the arches, and now they go up, they form the dorsal aorta. सो 2 हार्ट ट्यूब्स होते हैं. फ्रॉम 2 हार्ट ट्यूब्स 2 एओर्टा होते हैं, वेंट्रल एओर्टा, 2 आर्चेस एंड 2 डॉर्सल एओर्टा होते हैं, व्हिच देन फ्यूजेस. wait, let me just finish, I'll tell you. So now बाद में the heart tube fuse, बाद में heart tube fuse हो गए, single heart tube बन गया ना. Now there's a single heart tube. Now this is a single heart tube. The first chamber is bulbus cordis, ventricles, atria, sinus venosus. From this single heart tube, these are the 2 ventral aorta. The ventral aorta fuse, इसे बोलते हैं aortic sac. Aortic sac. Then we have got 2 arches and then dorsal aorta. Okay. देखो, I'll just make it like this. पहले कितने heart tubes थे? There were 2 heart tubes, right? 2 heart tubes थे. So what are these 2? ये दो कौन है? Ventral aorta. This is the ventral aorta. What are these 2? Arches. ये arches है. And what is this now? That's a dorsal aorta. ये कौन है? Dorsal aorta. समझ में आ रहा है? अब है ना, शरण, just wait, I'll tell you. So ये हार्ट है ना नीचे. So 2 हार्ट ट्यूब्स नीचे है, 2 आर्चेस है एंड 2 डॉर्सल एओर्टा है. लेटर ये दोनों फ्यूज हो जाते हैं. बोथ दिस हार्ट ट्यूब्स फ्यूज. अब क्या होगा? देयर विल बी अ सिंगल हार्ट ट्यूब, है ना, ट्रंकस आर्टेरियोसस, ये है ना, ये हार्ट ट्यूब हो गया. नाउ दिस 2 वेंट्रल एओर्टा फ्यूज. ये 2 वेंट्रल एओर्टा फ्यूज होते हैं. दिस इज नोन एज द एओर्टिक सैक. These are the 2 arches and this is the dorsal aorta. ये dorsal aorta है. What is this known as? Aortic sac. बच्चों समझ में आ रहे हैं? See, these are the heart tubes. What is this? Ventral aorta. This is ventral aorta. Ventral aorta. These are the arches and that's a dorsal aorta. हाँ, थोड़ा सा difficult है ये. I'm just telling you directly. So 2 heart tubes है, 2 ventral aorta है, 2 arches है, 2 dorsal aorta होते हैं. Now both the heart tubes fuse. So both the ventral aorta fuse. What is this now known as? Aortic sac. These are the 2 arches and that's a dorsal aorta. From this ventral aorta to the dorsal aorta, we get a series of arches. We get a series of connections. इसे बोलते हैं aortic arch arteries. So see here, this is ventral aortic sac है, that's dorsal aorta, and this are the aortic arch arteries. ये जो aortic arch arteries होती है ना, they lie in the pharyngeal arches. वो pharyngeal arches में lie करते हैं. They lie in the pharyngeal arches. That is around 4th week में होता है ये, 3rd week के end. Fine. So I'll start now. Have a look at this. I'm starting with the development of blood vessels. So just try to understand. थोड़ा सा difficult है, but try to understand this. So this is the aortic sac. These are the arches, and that's a dorsal aorta. This is the dorsal aorta. ठीक है, aortic sac. These are the arches. That's a dorsal aorta. Fine. Now, this is the first arch artery. This is the second arch artery, third arch artery, 4th, 5th, and 6th aortic arch arteries. This is the first arch artery. second arch artery. This is the third, fourth, fifth, and sixth. So how many aortic arch arteries are there? There are 6 aortic arch arteries. Fine. ये कौन है? Aortic sac. इसके नीचे क्या होगा? ये 4 chambers होंगे. Truncus arteriosus, ventricles, atria, sinus venosus. हाँ, I'm not drawing that. इसे नहीं draw करते. What is this? Aortic sac. Aortic sac is formed by the fusion of 2 ventral aorta. These are the arches, and this is the first, second, third, fourth, fifth, sixth. 6 aortic arch arteries होते हैं, out of which many disappears off. The first aortic arch artery disappears, the second disappears off. The first aortic arch artery is gone, the second disappears off. The fifth is gone. The fifth is gone. Fifth bit disappear हो गई. ठीक है, fifth is also gone. Fine. So that's the dorsal aorta. यह है dorsal aorta. This is the third arch artery. This is the fourth arch artery. This is the sixth arch artery. Okay. This is the aortic sac. That's the aortic sac. Fine. Clear? So the first is gone, second is gone, third रह जाता है, fourth रह जाता है, fifth is gone, sixth is left. I'll start. ये clear है बच्चों? What is aortic sac? It is formed by the fusion of 2 ventral aorta. These are the arches. These are the dorsal aorta, third, fourth, sixth arch arteries. Okay, I'll start. The sixth arch artery forms the pulmonary artery. The sixth arch artery forms the pulmonary artery. Fine. First arch artery disappear होता है, but उसका बनता है maxillary artery. Second arch artery disappear होता है, but उसका बनता है stapedial artery. स्वप्नमय. First arch is maxillary, second arch is stapedial. Fine. Now, the sixth arch artery forms the future pulmonary artery. It gives a small bud. इसको क्या बोलते हैं? Lung bud. It gives a bud. That's lung bud. Now, the part of the sixth arch artery between the lung bud and the aorta disappears off. यहाँ पे disappear हो गया. The part of the sixth arch artery between the lung bud and the aorta disappears off on the right side. On the left side, it remains. इसे क्या बोलते हैं? What is this known as? This is known as the ductus arteriosus. Ductus arteriosus. ठीक है, ये सब बहुत important है. So the sixth arch artery is going to form the pulmonary artery. It gives a small artery to the lungs, that is lung bud. On the right side, the part of the sixth arch artery between the lung bud and the aorta disappears off. On the left side, it forms the ductus arteriosus. Ductus arteriosus, fine. अब यहाँ पे एक nerve होती है which winds and which goes up. What's that? The left recurrent laryngeal nerve. So the left recurrent laryngeal nerve is found in the thorax. अब राइट साइड पे डक्टस नहीं होता है. So the right recurrent laryngeal nerve winds around the fourth arch artery. The fourth arch artery forms the subclavian artery. So the right recurrent laryngeal nerve is found in the neck. It winds around subclavian artery. The left recurrent laryngeal nerve winds around ductus arteriosus. Fine. This is clear. Now, what is left? Third, fourth arch artery. And this is the dorsal aorta. यह है aortic sac. Now, there are 2 arteries which comes and joins with the fourth arch artery. The arteries है which comes and joins with the fourth arch artery. इसका नाम है 7th cervical intersegmental artery. इसका नाम है 7th cervical intersegmental artery. It comes and joins with the fourth arch artery. The aortic sac divides into 2 parts. What is this? This is the left horn and that's the right horn of the aortic sac. It divides into a left and right horn. Fine. Now, quickly tell me, we are going to make this. Arch of aorta and its branches. Arch of aorta and its branches. So the aortic sac के 2 horns हो गए, left and right horn. यह है 7th cervical intersegmental artery. It comes from the body wall. ये body wall से आती है. It joins with the fourth arch artery. Now tell me, what is this going to form? The left horn of aortic sac and the left fourth arch artery. ये बनता है arch of aorta. So arch of aorta is formed by the left horn of aortic sac and the left fourth arch artery. Simple hai, Rishabh. You just have to revise it. It's easy. So the left horn of aortic sac and the left fourth arch artery is going to form the arch of aorta. Arch of aorta. Fine. what is this going to form? The left 7th cervical intersegmental artery is going to form what? The left subclavian artery. So left subclavian artery is derived from the left horn of aortic sac. The left subclavian artery is derived from the left 7th cervical intersegmental artery. The right 4th arch artery and the right 7th cervical, इससे बनेगा right subclavian artery. बच्चों subclavian artery दोनों sides पर different है. On the right side, the subclavian artery is derived from the right 4th arch artery and the right 7th cervical intersegmental artery. The left subclavian artery is derived only from left 7th cervical intersegmental artery. Easy है Richa, easy है. Now tell me what is this? ये बनता है, ये है right horn of aortic sac, and this right horn of aortic sac forms the brachiocephalic trunk. ये बनता है brachiocephalic trunk. Now tell me who's left? The third arch artery. The third arch artery का क्या बनता है? Common carotid. इसका बनता है common carotid. The third arch artery forms a common carotid. Fine. It gives a bud for external carotid. Okay, it gives a bud for external carotid artery, and itself continues as internal carotid artery with the dorsal aorta. The third arch artery forms the common carotid. ये बन गया common carotid. It gives a bud for external carotid and itself continues as internal carotid along with the dorsal aorta. Fine. Now this part of the dorsal aorta disappears. इसको बोलता है ductus caroticus. The part of the dorsal aorta between the third and the fourth arch artery होती है ना, वो disappear होता है, उसे हम बोलते हैं ductus caroticus. Okay. Fine. That is known as ductus caroticus. Clear? Now this entire dorsal aorta is gone. Entire, which is this right dorsal aorta, disappears off, and this is going to form what? अब ये क्या बनेगा? This is going to form the descending thoracic aorta. This is going to form the descending thoracic aorta. Fine, clear to all of you? So this is about the development of blood vessels. कुछ डाउट्स है इसमें तो बोलो. ठीक है, just forget it. Okay, fine. Now just tell me, students, just tell me one thing. If this is going to persist, अगर ये dorsal aorta persist होता है, so what is this going to form? What is this going to form? अगर ये persist होता है, persistence of right dorsal aorta results in what? Ductus caroticus ये है बच्चे. Ductus caroticus ये जो part disappear हुआ ना, the part of the dorsal aorta ये वाला था ना between the third and fourth arch artery, ये था ductus caroticus. इसको बोलते हैं ductus caroticus. वो disappear हो जाता है. The part of the dorsal aorta between the third and the fourth arch artery, that is ductus caroticus. Just tell me one thing बच्चों, अगर ये right dorsal aorta persist रहेगा, what will happen? Double aortic arch. Very good, very good. अगर ये right dorsal aorta persistent रहेगा, it results in double aortic arch. Fine. And suppose अगर ये right dorsal aorta persistent है, plus this disappears off. Now what is this going to form? So persistence of the right dorsal aorta with the disappearance of the right fourth arch artery. Now this results in an abnormal, yes, subclavian artery. Abnormal right subclavian artery. Fine. See, normally अगर ये persist ये रहा, this is the fourth arch artery है ना, ये fourth arch artery, if it is remaining, only this is persisting, so it results in a double aortic arch. एंड सपोज ये परसिस्ट रहा एंड दिस डिसअपियर्स ऑफ, अब ये पूरा बनेगा abnormal subclavian artery. फाइन, बस ये याद रखना. वेरी गुड. ठीक है, सो दिस इज व्हाट यू आर सपोज टू रिमेंबर. ओके ग्रेट, सो आई हैव टोल्ड यू एवरीथिंग. Now just tell me the development of diaphragm. एक last चीज बोलते हैं, development of diaphragm बोल सकते हो, development of diaphragm. So development of diaphragm, the main contribution to the development of diaphragm is what? बस ये याद रखना, septum transversum. Septum transversum, that forms the central tendon of diaphragm. Central tendon. So the main part of the diaphragm is derived from septum transversum and that forms the central tendon of the diaphragm. The next is the pleuroperitoneal membranes. बस ये याद रखना आप, pleuroperitoneal membranes ये बनाता है posterior part of central tendon. So the main central tendon is formed by septum transversum. The pleuroperitoneal membrane forms the posterior part of central tendon. Then the dorsal mesentery of esophagus. Dorsal mesentery of esophagus forms the crus of the diaphragm. Crus. What is left? And the last one is what? Body wall. Body wall that forms the peripheral part. Peripheral part of the diaphragm. So the body wall. Swapna, एक minute रुक, we'll discuss this. So the peripheral part of the diaphragm is derived from body wall, and that is why the peripheral part of the diaphragm is supplied by what? The peripheral part of the diaphragm is supplied by what? Anyone? Intercostal nerves. Intercostal nerves, because the body wall contributes to the formation of diaphragm. जो बॉडी वॉल है ना, वो डायफ्राम के फॉर्मेशन को कंट्रीब्यूट करता है, एंड दैट इज व्हाई द सेंसरी नर्व सप्लाई पेरिफेरल पार्ट का इंटरकॉस्टल नर्व्स होता है. द सेंट्रल पार्ट ऑफ द डायफ्राम इज सप्लाइड बाय फ्रेनिक नर्व. फ्रेनिक नर्व. फाइन. नाउ जस्ट टेल मी, ये बनता है स्ट्रक्चर ऑफ डायफ्राम. स्ट्रक्चर. The muscles of the diaphragm are derived from what? Muscles of the diaphragm are derived from cervical myotomes. Cervical myotomes. The muscles of the diaphragm are derived from cervical myotomes. मतलब muscles of the neck, they come down to form the diaphragm, and that is why the nerve from the neck goes to supply the diaphragm. The nerve from the neck goes to supply the diaphragm. That's phrenic nerve. That's phrenic nerve. हाँ, ये याद रखना बच्चों, ये बहुत ज्यादा इंपॉर्टेंट है. I must be having a good slide. Look at this. So quickly you tell me, what is this part? What is this part? This is the septum transversum. This is the pleuroperitoneal membrane. This is the dorsal mesentery of esophagus, and this is the body wall. Yes, that's a body wall. Muscles of the diaphragm are derived from cervical myotomes. Cervical myotomes. ठीक है. अब बोलो बच्चों, अगर ये pleuroperitoneal membranes fuse नहीं हुआ, if this pleuroperitoneal membranes do not fuse, there is a gap in the diaphragm. There's a gap in the diaphragm, and this is a posterolateral defect in the development of diaphragm. अगर ये pleuroperitoneal membranes fuse नहीं हुए, there's a gap in the posterior and lateral part of the diaphragm. What is this known as? What is this known as? Yes, anyone? A posterolateral defect in the development of diaphragm due to non-fusion of pleuroperitoneal membranes is known as? Any guesses? Yes, Shipra. हाँ बोलो, you know this. बोलो बोलो बोलो. Boctalix hernia. Boctalix hernia. Okay. अगर प्लूरोपेरिटोनियल मेम्ब्रेन्स फ्यूज नहीं होते हैं, there's a gap in the diaphragm which is posterior and lateral, that is known as Bochtelic's hernia. ये याद रखना, ये MCQs में आता है. Bochtelic's explain why में आता है. हाँ शिप्रा, just 2 minutes. Now quickly tell me, I'll just quickly tell you this. This is the sternum. This is the manubrium sternum, that's the body of the sternum. These are the thoracic vertebrae. ये है thoracic vertebrae. This is the diaphragm. These are the ribs. These are the ribs. What is this area known as? चलो शिप्रा, thoracic inlet है ना बच्चे. हाँ, thoracic inlet में क्या होता है? आगे sternum है, manubrium sternum है, पीछे T1 vertebrae, दोनों sides पर rib है. That is the inlet of the thorax. हाँ, अभी बोलो, what is this area? चलो fast, 5 more minutes. Come on students, come on, you can answer this. आगे sternum, पीछे vertebrae है, ऊपर first rib है, नीचे diaphragm है. This is a part of the thorax जिसमें heart होता है. The heart is lying here. That is the mediastinum. Very good. That is the mediastinum. An imaginary line joining this cuts the lower border of T4 vertebrae. From the manubrium sterni cuts the lower border of T4 vertebrae. ये होगा superior mediastinum, ये होगा inferior mediastinum. Superior, inferior mediastinum. अब superior mediastinum के 3 parts बनाते हैं इसके, anterior, middle, posterior. Anterior, middle, posterior. Can anyone tell me what are these muscles here? Starting from the sternum to the thyroid, starting from the sternum to the hyoid. This is the sternothyroid, sternohyoid. Sternothyroid, and यहाँ पे क्या होता है? A gland here. What is this gland? Thymus. So anterior part में क्या होता है? Sternohyoid, sternothyroid and thymus. Simple है. Sternohyoid, sternothyroid, thymus. In the middle part, what do we have? In the middle part, you have got, look, this is the arch of aorta and its branches. Arch of the aorta and its branches. Second, vein होता है, internal jugular, subclavian, brachiocephalic ये, and this is the formation of SVC. So this is the formation of SVC here. दूसरा होता है arch of aorta and its branches. And तो nerves आती है यहाँ पे. 2 nerves come here. What are these 2 nerves? Phrenic and vagus. Phrenic and vagus. So what is present in the middle part of the superior mediastinum? The formation of SVC, the arch of aorta and its branches, the phrenic and the vagus nerves. Phrenic and the vagus nerves. Now coming to the posterior part. Posterior part, we have got this tube which comes straight down. What is this tube? That's the esophagus. Esophagus. Then another tube which divides at T4. ये T4 पे डिवाइड होती है. ट्रेकिया. फिर आता है ये sympathetic chain. And then comes a duct here. Duct. What is that duct? Thoracic duct. ठीक है, thoracic duct. Okay, so in the posterior part, azygous इधर नहीं आता है. ऋषभ, azygous इधर नहीं आता है. Azygous यहाँ है ना, T4 पे खत्म होता है ना, T4 पे. So here what you have in the posterior part of the superior mediastinum, you've got trachea, esophagus, the left recurrent laryngeal nerve, the sympathetic chain, the thoracic duct. Very good. Now coming to the inferior mediastinum. Inferior mediastinum is divided into anterior, middle and posterior part. Who lies here? The heart and the pericardium. The heart and the pericardium. Okay, heart and the pericardium. What lies here? What is this in the anterior part? This is the sternopericardial ligaments. Sternopericardial ligaments. So superior and inferior sternopericardial ligaments. In the middle part, we have got the heart with the pericardium. And we have this phrenic nerve here. Phrenic nerve. अब पीछे क्या आएगा? Esophagus, यहाँ पे आता है डिसेंडिंग thoracic aorta. So esophagus, aorta, descending thoracic aorta. Then comes the azygous vein, hemiazygous vein, thoracic duct, vagus nerve, and the sympathetic chain. Vishal, very good. But this is in short that I've told you the mediastinum. Thank you, thank you. Yes, Mahesh, thank you. Clear to all of you. So that's how you understand the mediastinum. Fine. So in the posterior mediastinum, what do you have? Trachea. I mean, you've got the descending thoracic aorta, you've got the esophagus, बीच में thoracic duct, azygous vein, hemiazygous vein, accessory hemiazygous vein, sympathetic chain, the vagus nerve. फर्स्ट ईयर ज्वाइन करने वाले हो ना, बेसिक टॉपिक्स पढ़ लो, जॉइंट्स बोन्स पढ़ लो, जॉइंट्स एंड बोन्स पढ़ लो. यस रवि, थोड़ा सा है 11-12 का, बाकी मेनली इट इज ऑल ह्यूमन एनाटॉमी. सो बोन्स एंड जॉइंट्स चालू कर दो, बोन्स एंड जॉइंट्स चालू कर दो. फाइन. अभी क्या डाउट है किसी को, बोलो. सो दिस कंप्लीट्स एवरीथिंग, दिस कंप्लीट्स एवरीथिंग. ये है ना, एक मिनट, जस्ट हैव अ लुक एट दिस. आंसर दिस. Answer this. 65 years old male patient comes with complaints of severe chest pain. Pain was also felt along the left arm. It was accompanied by profuse sweating. He was a chronic smoker. He gave a history of similar but less severe pains over last 6 months. These past episodes were always experienced when he went walking or had to climb stairs. The pain used to ease after rest. His ECG was taken and he was advised to angiography. Which organ is most likely to be involved and the cause? ये क्या है? Vertebrae is important. Vertebrae is important, बच्चे. Vertebrae is important. So this is angina pectoris. ठीक है ना? तो ये angina pectoris है, ये heart attack नहीं है. Okay. Thank you, thank you. This is angina pectoris. बोलता हूँ, एक मिनट. Answer this. What is this? Answer for this. Myocardial infarction नहीं है बच्चे. Mahesh, it's angina pectoris. It's not myocardial infarction. It's angina pectoris. Answer this, Shipra. वो सर्वाइकल रिब होता है ना, तो ये ब्रेकियल प्लेक्सस एंड द सबक्लेवियन आर्टरी हैज टू क्लाइंब ओवर इट एंड गो. सो द ब्लड फ्लो becomes less. Blood flow becomes less. There's tingling and numbness. Fine. Answer this. What is the answer for this? Pleural effusion. Pleural effusion. Very good. Pericardial नहीं है बच्चे, pleural effusion है. Pericardial नहीं है, pleural है बच्चे. Pleural effusion है. Lungs है ना, lungs है. It's pleural effusion. Fine. These are some questions which are asked, very commonly asked questions. LAQs, SAQs है ये. हाँ, ये सब पढ़ लो. ठीक है. So this completes it. Fine. हाँ, बोलो. कुछ डाउट्स है किसी को तो पूछो. Anything, any doubts anyone has, you can ask me. Fine, bachcho, I hope everything is clear. In a short span of time, we have revised the thorax. And हाँ बोलो बच्चा, स्वप्ना में बोलो. In a short time, we have revised the thorax. ऐसे ही revision करना है आपको exam से पहले. Okay, you need not read everything. You are not supposed to sit and read line to line. You just have to think, and you have to recollect what you have read. Thank you, Rishabh. अरे महेश, यू स्टार्ट विद जॉइंट्स, यू स्टार्ट विद बोन्स. हाँ, धीरे धीरे स्टार्ट करो. जैसे कॉलेज शुरू हो जाएगा यू विल गेट ओरिएंटेड. हाँ, phrenic avulsion. Phrenic avulsion at the root of the neck. फ्रेनिक नर्व के साथ है ना पेरिकार्डियोफ्रेनिक वेसल्स होते हैं. पेरिकार्डियोफ्रेनिक वेसल्स, सो दैट में प्रोड्यूस हेमोरेज. महेश, there's a hard parts made easy series. हाँ, हार्ड पार्ट्स मेड इजी पीडब्ल्यू के चैनल पे है, यूट्यूब सीरीज है, फ्री सीरीज है, हार्ड पार्ट्स मेड इजी. जस्ट हैव अ लुक एट दैट सीरीज. हाँ बच्चों, ऑल ऑफ यू, हार्ड पार्ट्स मेड इजी का एक सीरीज है, उसमें ओनली इंपॉर्टेंट थिंग्स टू आंसर, वो कैसे आंसर करते हैं दैट आई हैव टोल्ड. फाइन. न्यूमोथोरैक्स इज एक्यूमुलेशन ऑफ एयर. जब स्टैब इंजरी होती है या फिर एक्सीडेंट्स होता है, there's accumulation of air within the thorax. हाँ, फिर उसमें ना एक आईसीडी डालते हैं, एक ड्रेन डालते हैं. हेड नेक एंड न्यूरो एनाटॉमी. कमलानी, यू आर आंसरिंग दिस वेरी वेल. बहुत अच्छे से आंसर, कामालिनी. हाँ, यू आर आंसरिंग वेरी वेल, डोंट वरी. हाँ, एचएफएन इम्पोर्टेंट टॉपिक्स कर लो, बिकॉज दीज आर वेरी वास्ट पोर्शंस, है ना. तो जस्ट डू इम्पोर्टेंट टॉपिक्स, just do important topics, that's it. थर्ड प्रॉफ में यू हैव टू स्टार्ट नीट पीजी प्रिपरेशन. स्टार्ट करना है आपको. हर्ष, यू हैव टू स्टार्ट योर नीट पीजी प्रिपरेशन. हाँ, कमालिनी, जस्ट फोकस ऑन द मेन टॉपिक्स, सब नहीं पढ़ना है. हाँ, लाइक ट्रायंगल्स पे फोकस करो, थायराइड पैरोटिड ग्लैंड्स पे फोकस करो, लैरिंग्स फैरिंग्स पे फोकस करो, बिकॉज इट्स अ वास्ट टॉपिक. साइनसेस, ड्यूरल वीनस साइनसेस है. Chronic obstructive pulmonary disease is different. It's a respiratory disorder and pleural effusion X-ray में दिखता है. X-ray में fluid levels दिखता है. That is pleural effusion, collection of fluid. महेश, neuroanatomy ना बच्चा, शिप्रा, neuroanatomy just start with the surfaces of the brain, the functional areas, the sulci gyri, then the blood supply of the brain, then start with the ventricles, go that way, then start with the sections of the brain, and finally the cerebellum. इतना ही पढ़ना है, इतना ही. नेसल सेप्टम भी इतना इंपॉर्टेंट नहीं है. दैट इज फॉर योर अंडरस्टैंडिंग. नेसल सेप्टम द, हाँ, दैट इज फॉर योर अंडरस्टैंडिंग बच्चा. एंड उसका ब्लड सप्लाई बट लिटिल सी एरिया इज इंपॉर्टेंट. उसमें कुछ क्लिनिकल इंपॉर्टेंट है. ओके बच्चों, हर्ष, स्टार्ट विथ bones and joints and then slowly you'll get oriented. Sanjay, upper limb is over बच्चा, upper limb is over. You'll understand. सब फर्स्ट ईयर के बच्चों, you'll understand slowly. हाँ, अभी शुरू करो with bones and joints, फिर धीरे धीरे orient हो जाओगे. We are there. Thank you so much. Thank you to all of you. Thank you so much. Have a pleasant night. अरे बच्चे, महेश, ब्लैक कलर दिखता है बट फ्लूइड लेवल दिखता है ना. इफ इट्स एन एफ्यूजन यू विल सी अ फ्लूइड लेवल. अगेन इट विल बी डल ऑन परकशन. ओके, थैंक यू, बाय बाय. I'll stop you.